Are you working in healthcare and trying to improve your English? This video brings together some of my most popular and practical medical English lessons from my channel, all in one place. Hi, I'm Jer and this is Learning English Pro, the home of medical English on YouTube. Whether you're a nurse, a doctor, a medical interpreter, or preparing for the OET exam, this compilation covers a wide range of essential topics, including vocabulary, abbreviations, patient communication, listening practice, and real-world phrases you can actually use on the job. Each lesson comes with a matching PDF guide. These are all available inside the student membership directory and in the membership tab here on my YouTube channel. If you're not a member yet, you can also grab the individual guides directly from my YouTube store. Everything is linked in the video. Student members get access to every guide I've published, plus a new downloadable workbook with each new video. Okay, let's dive into our masterclass. The first lesson covers 50 medical abbreviations. There's a lot to cover here, so make sure to take breaks and come back to the lesson. Think you know medical English? If you don't know these 50 medical English abbreviations, you could miss vital patient information, and fast. Hi, I'm Jer and welcome to Learning English Pro, the home of medical English on YouTube. Today we're diving into 50 of the most common medical abbreviations you'll find in any English language hospital or clinic. This lesson is great for nurses, doctors, or anyone working in a healthcare setting. We'll cover 10 essential categories to really get you started on understanding just a few of the thousands of abbreviations you'll find in medical English. And if you want more lessons on medical abbreviations, let me know in the comments. Each of the 50 abbreviations we'll cover will come with an explainer and a real example sentence to help you use the term confidently. There's a lot to take in here, so come back and test yourself anytime. And don't forget to like, subscribe, and share it with your healthcare colleagues. For my amazing student members, head over to the membership tab for your copy of the full guide. It has all the learning content from this lesson, plus a huge glossary of 100 terms and additional exercises to boost your knowledge. If you're not a student member, you can join right now. The link to join is in the video description. The guide for this lesson is also available in my YouTube store. Everything is linked in the description. Okay, that's enough business. Let's get down to our abbreviations. If you really want to use abbreviations appropriately, listen up. Some abbreviations in medicine are only written in notes or charts. Some are spoken out loud in hospitals or clinics, and many are used both ways. So, as we go through the list, I'll tell you whether each abbreviation is typically written, spoken, or both, and I'll highlight that clearly for every single one of them. Now, how I pronounce them in the example sentence depends on how they're actually used in conversation. If the abbreviation is usually said as the full word, I'll say the full word. So for the abbreviation or X, you'll hear me say, the doctor wrote a prescription for antibiotics. But for something normally spoken as the abbreviation, like CPR, I'll say, the patient collapsed and CPR was initiated immediately. This way, you'll hear what native speakers would actually say, not just what's written down. If you're confused, pick up a copy of the guide. It's all laid out very clearly. Now let's jump into our first category, which is vital signs and monitoring. Our first abbreviation is BP, which stands for blood pressure. This is used in both spoken and written English. It means the force of your blood pushing against the walls of your arteries. Let's take a look at our example sentence. The patient's BP is dangerously low at 80/50. Our next abbreviation is HR, or heart rate, and this means the number of heartbeats per minute. HR can be used in both spoken and written English. Our example sentence is, monitor the HR and report any changes above 100 BPM. BPM is another abbreviation meaning beats per minute. Let's move on to or respiratory rate. This relates to the number of breaths a person takes per minute, and we can use or in spoken and written English. Our example sentence is, his or increased to 26 after the procedure. Our fourth abbreviation is written only. It is written as SpO2, and it refers to oxygen saturation. Oxygen saturation refers to the percentage of oxygen in the blood. Let's take a look at our example sentence. Her oxygen saturation dropped to 91%, so we began oxygen therapy. And abbreviation number 5 is our shortest abbreviation in our list, T for temperature. And of course, temperature relates to the body's internal heat, usually measured in Celsius or Fahrenheit. We can use the T abbreviation in both spoken and written English. Our example sentence is, patient's T is 38.6 degrees Celsius, indicating a possible infection. So, well done. Those first 5 abbreviations are essential for assessing patient stability. They're critical English for every member of the medical team. Let's have a quick quiz question. Which abbreviation refers to the percentage of oxygen in the blood? The correct answer is number 4. Well done if you got that right. Okay, let's move on. But before we do, if you haven't subscribed yet, click the button to stay updated on all my medical English lessons. The next topic is a really interesting one. It relates to body systems and assessments. Our first abbreviation is CNS. This refers to the central nervous system, and this abbreviation is both written and spoken. We're checking for signs of CNS depression after the overdose. Next up, number 7, we have CVS, which relates to the cardiovascular system. This is the heart and blood vessels working together. And again, CVS can be used in written and spoken English. He has a history of CVS disease, so monitor his vitals closely. Number 8 is GI, or gastrointestinal, relating to the digestive system. Again, GI can be said or written in English. The patient reports GI discomfort after eating. Our 9th abbreviation is GU, or genitourinary, which refers to the urinary or genital organs. A GU infection is suspected due to the presence of blood in the urine. So here you can see it's written and spoken. Our 10th abbreviation is MSK, or musculoskeletal. This abbreviation refers to muscles, bones, and joints, and again, it can be written or spoken. She has MSK pain following a workplace injury. Great job! These abbreviations help you speak clearly about different systems in the human body, super important when communicating across departments. Let's have a quick quiz. Which abbreviation is used when referring to the heart and blood vessels? The correct answer is CVS. If you got that right, give yourself a pat on the back. If you're finding these abbreviations challenging, don't worry, they are very tricky. But if you download the guide that's available for my student members or on my YouTube store, you'll give yourself a really good boost in this area of medical English. Okay, next up, we're covering abbreviations relating to medical history and patient notes. Our first abbreviation in this category is written only. HO, or history of. This refers to a patient's past conditions. Our example sentence is, patient has a history of hypertension and diabetes. And next we have DC, which can mean either discharge or discontinue. This abbreviation can be written or spoken, and depending on the context, means to release or stop something. Our example sentence is, the patient was DC'd yesterday afternoon. Next we have NKA, or no known allergies. This indicates no allergies have been reported by a patient. This is a written abbreviation. Our example sentence is, she's no known allergies, so we proceeded with the standard antibiotic. Also written is NKDA. No known drug allergies. This specifically states no medication allergies for a patient. Our example sentence is, no known drug allergies, administered amoxicillin. Next up, we have SOB, which means shortness of breath or difficulty breathing. SOB is used in written and spoken English. Patient presented to the ED with acute SOB. You're doing amazing work. These kind of abbreviations you'll see constantly in patient records. Here's your next quiz. What does NKA stand for? The correct answer is no known allergies. Nicely done if you got that right. If you're finding this lesson helpful, make sure to click the like button and share it with a colleague. Maybe watch it together and have a chat about all the different abbreviations you're learning. Our fourth section covers abbreviations used for tests and investigations. And all the abbreviations in this category can be both spoken and written. And first up, we have CBC. This relates to the complete blood count, a test that evaluates overall health and detects disorders. The CBC showed elevated white blood cells. CMP, or Comprehensive Metabolic Panel, is of course the blood test measuring glucose, electrolytes and more. We ran a CMP to check her kidney and liver function. We also have the abbreviation CXR, or a chest X-ray. And of course, this is an image of a chest to check lungs and heart. A CXR was ordered to rule out pneumonia. MRI, as an abbreviation, stands for magnetic resonance imaging. This is a scan to produce a detailed image of organs and tissues. Our example sentence is, an MRI was scheduled for the patient's lower spine. Our 20th abbreviation is ECG, or EKG. This refers to an electrocardiogram, which measures the heart's electrical activity. The EKG showed signs of atrial fibrillation. Brilliant! These abbreviations are vital for interpreting results and ordering tests. Let's check your knowledge. Which abbreviation refers to a test that checks your blood for white and red cells? Did you get it? The correct answer is CBC. Great work. Don't forget, you can pick up a guide for this lesson as a student member on my channel. Student members get access to every PDF I've ever written for this channel and every new one that comes along. There's also 300 members-only videos on my channel. That's 300 English lessons waiting for you right now. The link to join is in the video description. Our next topic focuses on medication and prescriptions. First up, we have RX, a written abbreviation. This means prescription, a written order for medicine. The doctor wrote a prescription for antibiotics. PRN is our next abbreviation, and it can be both written and spoken, and it means as needed, a medication given only when necessary. Morphine, 5 mg PRN for pain. BID stands for twice a day. It's from Latin and this one is written only. Take this tablet twice a day with food. Similarly, we have TID, also from Latin. This means 3 times a day, and this one's also written. Our example sentences: prescribed 250 mg 3 times a day for 5 days. Our final abbreviation in this category is IV, or intravenous. This is spoken and written. And this means that something like a medication is delivered directly into a vein. Our example sentences: administered IV fluids after dehydration. Wow, that's another powerful batch of abbreviations you've learned, especially for anyone handling medication. These abbreviations help keep drug instructions short but clear. Are you ready for quiz time? Which abbreviation means a medication taken 3 times a day? The correct answer is TID. Well done. Have any of the abbreviations surprised you so far? Have you seen one before and now you really understand what it means? Let me know in the comments below. I'd love to hear from you. Our journey through medical abbreviations takes us to emergency terms. And all the abbreviations in this section can be both written and spoken in English. And first up, we have CPR, or cardiopulmonary resuscitation, and of course refers to a life-saving procedure for cardiac arrest. The patient collapsed and CPR was initiated immediately. AED. This refers to an automated external defibrillator, a portable device that delivers an electric shock to restart the heart. We used the AED before the ambulance arrived. LOC stands for loss of consciousness. This means when someone becomes unresponsive. He experienced LOC for approximately 30 seconds. Our next abbreviation is one you'll always hear in the movies or in TV shows. STAT. This means immediately. It's a command for urgent action or results. We need a STAT ECG. He's not stabilizing. Our 30th abbreviation is BLS, or Basic Life Support, a level of emergency care for unresponsive or non-breathing patients. All healthcare workers are required to maintain valid BLS certification. Well done, those last 5 abbreviations are really crucial in emergency medicine. They are critical English for every member of the team. Let's have a quick question. Which abbreviation is used when a procedure or result is needed urgently? And yes, the correct answer is STAT. Well done if you got that right. Let's move on to category number 7, nursing and monitoring. And all the abbreviations in this section, apart from the last one, are both written and spoken. ADL refers to activities of daily living. This means basic personal care tasks like eating or bathing. She needs assistance with all ADLs following her stroke. INO refers to intake and output. This is the measurement of fluids consumed and excreted. Our example sentence is, please document INO every shift for this patient. NPO is nothing by mouth. This is a restriction on eating or drinking. The patient is NPO ahead of surgery. VS means vital signs. These are key indicators of patient's health. Our example phrase is, record the VS every 4 hours post-op. And our last abbreviation in this category is written only, Q4H, which means every 4 hours. This is a frequency of checks or for medication. Vitals must be taken every 4 hours on this ward. Excellent work, well done. Those abbreviations appear constantly in nursing notes and charts, so getting familiar with them is a must. Quick quiz. What does NPO mean? Did you get it right? The correct answer is nothing by mouth. Great job if you remember that. If you're finding this lesson useful, make sure to hit the subscribe button. It really helps the channel. Next up, let's go over abbreviations related to labs and fluids. And in this section, all the abbreviations are written only, except for the last one. First up, we have Na+, which stands for sodium, an important electrolyte in the blood. The sodium level was slightly elevated after dehydration. Next, we have a K+, which means potassium, which is another key electrolyte for nerve and muscle function. Low potassium can lead to arrhythmias. Watch those levels closely. BUN stands for blood urea nitrogen. This measures kidney function. The blood urea nitrogen result suggests reduced kidney filtration. The abbreviation CR stands for creatinine, another key indicator of kidney health. Her creatinine levels have improved since starting treatment. Next up we have IVF, which stands for intravenous fluids. These are fluids delivered directly into a vein. We started IVF to stabilize her after blood loss. Now just note, IVF on the street is commonly known to refer to in vitro fertilization. So just make sure you understand the context in which it's been said. Well done, brilliant stuff. All of these terms are often seen in lab reports and fluid balance charts. They're essential for understanding patient hydration and kidney function. Okay, it's quiz time. Which abbreviation refers to fluids given through a vein? And yes, it's the last one we just had, IVF. Excellent if you caught that. Well, we are soaring through all of our abbreviations. Well done for sticking around this far. We're at our final 10. And our next category is category 9, admissions and transfers. And all of the abbreviations in this section can be both written and spoken in English. ED refers to the emergency department, the hospital area for urgent care. The patient was brought to the ED with chest pain. ICU. This stands for Intensive Care Unit, a unit for critically ill patients. He's being transferred to ICU for closer monitoring. L&D stands for Labour and Delivery, the unit where childbirth occurs. She was admitted to L&D at 38 weeks. Our next abbreviation is OBS. So we don't say OBS here, we say OBS, which is short for observation, a period of monitoring without full admission. He was kept in OBS overnight for further evaluation. Abbreviation number 45 is AMA, Against Medical Advice. This is when a patient leaves the hospital without approval. She signed an AMA form and left before discharge. You're doing so well. These abbreviations help staff coordinate where patients are and how their care is managed. Let's try another quiz. Which abbreviation is used for patients who leave hospital before being discharged by a doctor? And yes, the correct answer is AMA. Give yourself a clap on the back. Our final category includes some very important terms used in legal, safety, and communication settings. And all of these terms can be used in both written and spoken English, except the very last one. DNR stands for Do Not Resuscitate. This is a legal order to not perform CPR. The chart includes a signed DNR order. HIPAA is an abbreviation which stands for Health Insurance Portability and Accountability Act. This is a US law protecting patient privacy. Sharing patient info without consent breaches HIPAA. SBAR stands for Situation, Background, Assessment and Recommendation. This is a type of communication framework for handovers. Use SBAR when calling the doctor with a concern. PPE. This stands for Personal Protective Equipment. This refers to all the safety gear like gloves, masks and gowns worn in a hospital setting. Always wear PPE when dealing with infectious patients. And our final and 50th abbreviation is QA, which stands for Quality Assurance, and this abbreviation is generally written. It means a system to maintain healthcare standards. The Quality Assurance audit revealed gaps in medication tracking. Well done. You made it to the end of all 50 abbreviations. You have done absolutely fantastic. If you're a student member, head over to the membership tab right now to pick up the guide for this lesson. It's great for further study and includes an extensive glossary and 3 additional exercises to really boost your comprehension around these medical abbreviations. And if you're not a student member, don't worry. You can pick up the guide in the YouTube store for just $4.99. I hope you enjoyed this lesson on medical abbreviations. There are thousands and thousands of medical abbreviations out there in the world, so if you want me to do more lessons on them, just let me know in the comments below. I'd love to hear from you. Don't forget to like, share, and subscribe. Don't When you're interpreting in a hospital, your words are more than just translations. They are bridges between people, cultures, and care. Hi, I'm Jer from Learning English Pro, the home of medical English on YouTube. And today's video is a complete training tool for medical interpreters working in real-world settings. We'll go through 100 useful professional English phrases, all grounded in actual conversations from clinics, hospitals, and community health settings. This lesson is designed to help you sound more confident, stay calm in high-pressure situations, and provide the most accurate, human-centered interpretation possible. We'll break the lesson into 10 themed sections with 10 phrases in each. And I'll be giving you lots of quiz questions throughout to check your comprehension. So whether you're training, revising, or already on the job, you'll walk away with practical tools to use right away. For my student members, there is a fantastic downloadable PDF version of this lesson, complete with exercises, listening practice, and glossary support. Each phrase is in the guide and comes with an additional full explanation of both its meaning and nuances. You can access the guide through my student membership. The link to join is in the video description, or you can purchase it as a one-time download from my YouTube store for just $4.99. Okay, let's jump into our first topic, general intake and checkups. You'll hear each phrase twice for perfect pronunciation. The interpreter will now interpret everything said in the first person. The interpreter will now interpret everything said in the first person. Please speak directly to the patient, not to me. Please speak directly to the patient, not to me. Can you tell me the reason for your visit today? Can you tell me the reason for your visit today? Do you have any allergies to medication? Do you have any allergies to medication? How would you rate your pain on a scale from 1 to 10? How would you rate your pain on a scale from 1 to 10? Have you experienced this issue before? Have you experienced this issue before? When did symptoms start? When did symptoms start? Are you currently taking any medication? Are you currently taking any medication? Let me know if you'd like me to repeat or clarify anything. Let me know if you'd like me to repeat or clarify anything. I will interpret everything you say as accurately as possible. I will interpret everything you say as accurately as possible. Well done. These 10 phrases are essential tools for intake interviews, general checkups, and any appointment where you need to guide the communication clearly and professionally. Let's have our first question. Which phrase explains that the interpreter will speak in the voice of the patient using I and you? The correct answer is, the interpreter will now interpret everything said in the first person. If you're enjoying the lesson so far, hit the like and subscribe. New medical English content drops every single week. Up next, we're heading into a more intense setting. Phrases for emergencies and urgent care. The doctor needs to ask some quick questions. Please answer briefly if you can. The doctor needs to ask some quick questions. Please answer briefly if you can. Can you point to where it hurts the most? Can you point to where it hurts the most? Are you having any difficulty breathing? Are you having any difficulty breathing? Have you lost consciousness at any point? Have you lost consciousness at any point? Do you have any chest pain or tightness? Do you have any chest pain or tightness? They're going to check your vital signs now. They're going to check your vital signs now. Please try to stay still. We're going to help you. Please try to stay still. We're going to help you. The doctor is on their way. The doctor is on their way. Can you describe what happened just before you collapsed? Can you describe what happened just before you collapsed? We're preparing you for imaging. Please remain calm. We're preparing you for imaging. Please remain calm. That was certainly a fast-paced section. These are moments when clear professional interpretation matters most. Okay, quiz time. Which phrase would you use when the doctor wants to quickly understand how a patient fainted? The correct answer is, can you describe what happened just before you collapsed? Well done if you got that right. If you're finding this lesson helpful so far, let me know in the comments. Which phrase are you most likely to use first? And don't forget, on student membership, you can download the guide for this lesson or pick it up in my YouTube store for $4.99. Next, let's turn to a critical part of any interpreter's work: supporting patients during procedures and medical interventions. We're going to begin the procedure now. We're going to begin the procedure now. You may feel some pressure, but it shouldn't be painful. You may feel some pressure, but it shouldn't be painful. The nurse is going to insert an IV. It may sting for a moment. The nurse is going to insert an IV. It might sting for a moment. Please lie still while we monitor your heart. Please lie still while we monitor your heart. They're going to numb the area first. They're going to numb the area first. You'll be under general anesthetic. You won't feel or remember anything. You'll be under general anesthetic. You won't feel or remember anything. We need your consent before we can continue. We need your consent before we can continue. Do you have any questions about the procedure? Do you have any questions about the procedure? The procedure is finished. You're in recovery now. The procedure is finished. You're in recovery now. You'll be monitored closely for the next few hours. You'll be monitored closely for the next few hours. Well done. These phrases are the backbone of safe, clear communication during procedures and treatments. Question time. Which phrase explains that the patient will be fully unconscious for surgery? Did you get it right? The correct answer is, you'll be under general anesthetic. You won't feel or remember anything. If you'd like to download all 100 phrases, along with language tips and extra exercises, check out the PDF guide for this lesson. It's really useful for medical interpreters. Now let's move on to one of the most sensitive interpreting environments: mental health and emotional support. Have you been feeling sad, anxious, or overwhelmed lately? Have you been feeling sad, anxious, or overwhelmed lately? How is your sleep? Are you having trouble falling or staying asleep? How is your sleep? Are you having trouble falling or staying asleep? Are you having any thoughts of harming yourself or others? Are you having any thoughts of harming yourself or others? Everything you share is confidential unless there is immediate risk. Everything you share is confidential unless there's immediate risk. Would you like to speak to a therapist or psychologist? Would you like to speak to a therapist or psychologist? You're not alone. There is help available. You're not alone. There is help available. They're here to listen and support you without judgment. They're here to listen and support you without judgment. It's okay to take your time. We can pause anytime. It's okay to take your time. We can pause anytime. Would you like to continue this conversation in a private space? Would you like to continue this conversation in a private space? Let me know if you feel unsafe at any time. Let me know if you feel unsafe at any time. That was a powerful and emotional section, and your role as an interpreter can make a life-changing difference in these moments. Okay, quiz time. Which phrase reminds the patient that everything they say is private unless there's a danger? Did you get it? The correct answer here is, everything you share is confidential unless there's immediate risk. Well done for getting that right. And that is 40 phrases under your belt already. Well done. Now let's move on to topic number 5, physical exams and diagnostics. We're going to look at phrases on how to interpret clearly during these procedures. The doctor is going to listen to your heart and lungs now. The doctor is going to listen to your heart and lungs now. Please take a deep breath in and out. Please take a deep breath in and out. Let me know if you feel any discomfort or pain. Let me know if you feel any discomfort or pain. I'm going to press here. Tell me if it's tender. I'm going to press here. Tell me if it's tender. We're going to take a blood sample now. We're going to take a blood sample now. You might feel a small pinch or sting. You might feel a small pinch or sting. We're sending this to the lab for testing. We're sending this to the lab for testing. Please change into this gown and let us know when you're ready. Please change into this gown and let us know when you're ready. You can close your eyes and try to relax. You can close your eyes and try to relax. We'll explain the results once they're available. We'll explain the results once they're available. Excellent work. These phrases are incredibly useful during routine exams, scans, and sample collection. Which of these phrases explains what happens after a blood test? The correct answer is, we're sending this to the lab for testing. Well done if you got that right. If you're finding this lesson valuable, consider becoming a student member. You'll get the full guide plus 70 additional PDFs from my directory and over 300 exclusive English lessons on my YouTube. Next up is topic 6, talking to family and support people during appointments. Would you like to have someone stay with you during the appointment? Would you like to have someone stay with you during the appointment? Your support person can stay in the room if you feel comfortable. Your support person can stay in the room if you feel comfortable. They're doing well. We're just monitoring them now. They're doing well. We're just monitoring them now. You're welcome to step outside if you need a break. You're welcome to step outside if you need a break. Would you like us to explain what's happening? Would you like us to explain what's happening? We'll give you an update as soon as we can. We'll give you an update as soon as we can. They're going to need some quiet time to recover. They're going to need some quiet time to recover. Please try not to overwhelm them with questions. Please try not to overwhelm them with questions. Do you have any concerns you'd like to address? Do you have any concerns you'd like to address? They're safe, stable, and being looked after. They're safe, stable, and being looked after. Well done. This section helps bridge communication between patients, families, and staff in a respectful, calm way. Quick quiz time. Which phrase gives a soft suggestion to let the patient rest without questions? Did you get it? The correct answer is, please try not to overwhelm them with questions. Well done for getting that right. Coming up is topic 7, phrases used when coordinating with medical teams behind the scenes. Can someone assist me in here, please? Can someone assist me in here, please? Let's quickly review the plan before we begin. Let's quickly review the plan before we begin. Vitals are stable, no changes since the last check. Vitals are stable, no changes since the last check. Could you prepare the meds while I set up the monitor? Could you prepare the meds while I set up the monitor? Patient is alert and responding appropriately. Patient is alert and responding appropriately. Let's debrief afterward to make sure everything's documented. Let's debrief afterward to make sure everything's documented. Can you double check her chart for allergies? Can you double check her chart for allergies? Let's call for the anaesthetist. She's requesting an epidural. Let's call for the anaesthetist. She's requesting an epidural. Do you want to escalate or wait another 10 minutes? Do you want to escalate or wait another 10 minutes? We'll update the family once things have stabilized here. We'll update the family once things have stabilized here. Great job. You are doing so well. These phrases are vital for working behind the scenes with the medical team, where accuracy, tone, and discretion all matter. Which phrase might be used when deciding whether to proceed with the clinical intervention? The correct answer is, do you want to escalate or wait another 10 minutes? Next, let's go into the delivery room, where communication moves fast and every word matters. You're fully dilated. It's time to start pushing. You're fully dilated. It's time to start pushing. Push when you feel the urge. Push when you feel the urge. Take a deep breath and push as hard as you can. Take a deep breath and push as hard as you can. Try to rest between contractions if you can. Try to rest between contractions if you can. I can see the baby's head. You're doing great. I can see the baby's head. You're doing great. Let's try a new position to help things progress. Let's try a new position to help things progress. We need to call the obstetric team now. We need to call the obstetric team now. You might feel burning. That's normal at this stage. You might feel burning. That's normal at this stage. One more big push. The shoulders are next. One more big push. The shoulders are next. The baby is here. You did it. The baby is here. You did it. That was a powerful section. These phrases help guide the most intense moments of life with dignity and calm. If you're looking for more phrases for midwives and maternity care, check out one of my recent lessons. I'll link it on screen and in the video description for you. Now let's have a quick question on these phrases. Which phrase prepares the patient for the sensation of crowning? Did you get it? The correct answer is, you might feel burning. That's normal at this stage. And wow, we're almost at the end. Next up is topic 9. We're turning to postnatal recovery and discharge communication. How are you feeling, physically and emotionally? How are you feeling, physically and emotionally? You may feel cramping. That's the uterus shrinking. You may feel cramping. That's the uterus shrinking. Let me know if you're in any pain so we can manage it. Let me know if you're in any pain so we can manage it. You're doing really well. It's completely normal to feel overwhelmed. You're doing really well. It's completely normal to feel overwhelmed. We'll check your stitches now. It may feel a little uncomfortable. We'll check your stitches now. It may feel a little uncomfortable. Try to rest when the baby is sleeping. Try to rest when the baby is sleeping. Let's talk about feeding options. What are your thoughts? Let's talk about feeding options. What are your thoughts? I'll show you how to hold the baby and I'll guide your hand. I'll show you how to hold the baby and I'll guide your hand. We'll monitor your vitals for the next few hours. We'll monitor your vitals for the next few hours. You'll receive some written information before you go home. You'll receive some written information before you go home. Great work. These phrases support recovery, safety, and confidence as the patient transitions to home care. Which of these phrases is used to help normalize the emotional intensity of the postpartum period? Did you get it? The correct answer is, you're doing really well. It's completely normal to feel overwhelmed. And now for our final topic, topic number 10, comfort, reassurance, and empowerment. These phrases are all about offering supportive empowerment every interpreter should know. You're not alone. We're here to support you. You're not alone. We're here to support you. It's okay to feel nervous. Many people do. It's okay to feel nervous. Many people do. There's no rush. Take your time. There's no rush. Take your time. You're doing more than enough. You're doing more than enough. You don't need to be perfect. Just do your best. You don't need to be perfect. Just do your best. If something doesn't feel right, speak up. If something doesn't feel right, speak up. You're safe here. We're doing everything we can. You're safe here. We're doing everything we can. Every situation is different. There's no right way to feel. Every situation is different. There's no right way to feel. We're with you every step of the way. We're with you every step of the way. You've done something incredible. You've done something incredible. And congratulations! You've just completed 100 phrases for medical interpreters, a full-length masterclass in professional, compassionate and clear communication across a wide range of medical situations. If you found this helpful, don't forget you can download the full PDF guide. The guide contains every phrase from this lesson, and every phrase comes with a language tip and explainer, really good for watching along with the video. The guide also includes a full glossary and additional exercises to really boost your comprehension. It's available right now for student members on the membership tab. Joining student membership with Learning English Pro is great value. For just $4.99 a month, you get access to every PDF guide I've ever made. That's running at 75 professional PDF guides. And with student membership, you'll also gain access to my library of over 300 English lessons. Join membership today, the link is in the video description, and gain access to a whole new world of English learning. Hello and welcome to Learning English Pro. My name is Jer and today I'm here to help you learn 100 essential English phrases for beginner nurses. If you're a new nurse or nursing student, especially if English is not your first language, this lesson will boost your confidence in speaking with patients and co-workers. Being a nurse is challenging, but you're not alone. I've got your back with practical phrases you can start using right away to make your job easier and your patients more comfortable. I've organized these 100 phrases into 10 useful categories, each with 10 simple phrases. We'll cover everything from greetings and daily care to talking with doctors. For each phrase, I'll speak slowly and you'll hear each phrase twice. By the end of this video, you'll have a toolkit of kind, professional phrases to use in common nursing situations. And if you want to learn even more about each phrase, I've created a guide especially for this lesson. The guide includes all 100 phrases with extra examples and tips, and you can get it for $4.99 on my YouTube store. Or if you're one of my student members, you can download it for free as part of your membership. The guide includes a glossary and 2 additional exercises to really boost your knowledge around this area of medical English for nurses. So after all that business, let's get right to it. And our first category for our Nurse Beginners English is greetings and introductions. Remember, I'll say each phrase twice and give you space to say it too. First impressions matter in nursing. Use these phrases to greet patients politely and start building trust from the very first hello. Hello, my name is Jer. I'll be your nurse today. Hello, my name is Jer. I'll be your nurse today. How are you feeling today? How are you feeling today? It's nice to meet you. It's nice to meet you. Good morning. Good morning. I will take good care of you. I will take good care of you. Let me know if you need anything. Let me know if you need anything. Are you comfortable? Are you comfortable? Did you sleep well? Did you sleep well? How can I help you? How can I help you? Do you have any questions? Do you have any questions? Great job! Which greeting or introduction phrase did you find the most useful? Let me know in the comments below. And remember, all the phrases and more are in the downloadable guide, so grab it if you need a handy reference. Now, let's move on to our next section, where we talk about something every patient cares about: food and meal times. Eating well is important for recovery. These phrases will help you talk to patients about meals, drinks, and dietary needs in simple English. Are you hungry? Are you hungry? It's time for breakfast. It's time for breakfast. Would you like something to eat? Would you like something to eat? Do you need help eating? Do you need help eating? I'll bring your food now. I'll bring your food now. Would you like some water or juice? Would you like some water or juice? How is the food? How is the food? Are you thirsty? Are you thirsty? Are you on a special diet? Are you on a special diet? Would you like some more food? Would you like some more food? Excellent. Now a quick quiz. If a patient has trouble feeding themselves, which phrase from this section could you use to offer help? Think about it. Yes, it's this one. Do you need help eating? It is the perfect phrase in this situation. Great work if you got that right. If you're finding this lesson useful, why not share it with a colleague and practice these phrases together? And don't forget to like and subscribe. Next, let's move on to personal care. Patients often need help with personal care. Here are 10 simple phrases to help you assist with using the bathroom, keeping clean, and staying comfortable, all while being respectful and gentle. Do you need to use the bathroom? Do you need to use the bathroom? I can help you to the bathroom. I can help you to the bathroom. The bathroom is over here. The bathroom is over here. Let me help you wash your hands. Let me help you wash your hands. It's time to change your clothes. It's time to change your clothes. I will help you take a shower. I will help you take a shower. Let's get you cleaned up. Let's get you cleaned up. Do you need help brushing your teeth? Do you need help brushing your teeth? I'll bring you a clean gown. I'll bring you a clean gown. I will close the curtain for you. I will close the curtain for you. Great job! Which of these personal care phrases do you think you'll use the most in your daily work? Share your thoughts in the comments. For example, many nurses frequently say, "Do you need to use the bathroom?" throughout their shift. If you haven't yet, download the guide to review all these phrases later. Now, let's continue to an important clinical part of nursing: vital signs and monitoring. Nurses check vital signs to monitor a patient's health. These phrases will help you explain and carry out blood pressure checks, temperature readings, and other monitoring tasks clearly and calmly. I need to check your blood pressure. I need to check your blood pressure. I need to take your temperature. I need to take your temperature. I will check your pulse. I will check your pulse. Let me check your oxygen level. Let me check your oxygen level. Please breathe normally. Please breathe normally. Take a deep breath. Take a deep breath. Hold still, please. Hold still, please. Roll up your sleeve, please. Roll up your sleeve, please. Relax your arm. Relax your arm. Your blood pressure is normal. Your blood pressure is normal. Awesome, you're doing so well. Let's have a pop quiz. What phrase would you use to instruct a patient to take a big inhalation while you listen to their lungs? Got it? Yes, it's take a deep breath. Excellent. Keep practicing these phrases so they become second nature. Remember, all these sections are part of my Medical English Masterclass that's coming right up after these 100 phrases. It's full of lots of individual medical English lessons, and they're all timestamped in the video description so you can navigate to the lesson of your choice. Next up, we'll cover phrases for pain and discomfort, an area where clear communication is very important. With this section, keeping your language simple and soothing will encourage patients to communicate their needs. Are you in pain? Are you in pain? Where does it hurt? Where does it hurt? Does it hurt here? Does it hurt here? Does it hurt when you move? Does it hurt when you move? How bad is the pain? How bad is the pain? Let me know if it hurts. Let me know if it hurts. I'll give you something for the pain. I'll give you something for the pain. I will help you get comfortable. I will help you get comfortable. Do you feel better now? Do you feel better now? Tell me if it gets worse. Tell me if it gets worse. You're doing so well. Pain management is really crucial. Which phrase from this section do you think is the most important to remember? Personally, I think how bad is the pain is pretty essential because understanding pain level helps decide what to do next. If you have a different favorite phrase, share it in the comments. And remember, these phrases are all in the downloadable guide with extra explanations. Now let's continue to section 6, which is all about safety and movement. Patients might be unsteady or confused, so nurses often need to give simple instructions to keep them safe. These 10 phrases will help you encourage safety and assist patients with moving around. Please be careful. Please be careful. Don't get up alone. Don't get up alone. Use the call button if you need help. Use the call button if you need help. I will help you walk. I will help you walk. Hold on to the railing. Hold on to the railing. The floor is slippery. The floor is slippery. Move slowly, please. Move slowly, please. Please sit down. Please sit down. Wait for me to help you. Wait for me to help you. Watch your step. Watch your step. Fantastic. That's another 10 phrases under your belt. Safety is key, and you now have some clear, polite commands to use with your patients. Try to imagine using these phrases during your day. For example, when transferring a patient from a bed to a wheelchair, you might say, "Don't get up alone. Wait for me. I will help you." See how these phrases can work together? If you have a scenario in mind, feel free to write it in the comments using some of the safety phrases. It's a great way to practice. And a quick reminder, if you're finding this video helpful, consider becoming a Learning English Pro student member. Members get access to all my lesson guides, including the one for this video, and lots of extra practice materials. Now, let's keep up the momentum and move on to section 7, emotional support and reassurance. Hospital stays can be scary or stressful. As a nurse, your words can comfort and reassure patients. Here are 10 simple phrases to offer emotional support and empathy when patients feel anxious, afraid, or sad. You are doing great. You are doing great. Everything will be okay. Everything will be okay. You are in good hands. You are in good hands. We are here for you. We are here for you. You are not alone. You are not alone. Don't worry, we will take care of you. Don't worry, we will take care of you. I understand how you feel. I understand how you feel. It's normal to feel this way. It's normal to feel this way. Let's take it one step at a time. Let's take it one step at a time. Do you want to talk about it? Do you want to talk about it? Wonderful, great job. Being a nurse isn't just about medical tasks, it's also about caring. Using phrases like these can really comfort your patients. Let's have a quick question. If a patient says, "I'm scared about my surgery," what could you reply? There are a few options here, but a good one is, "It's normal to feel this way. You are in good hands." See how we combined two reassuring phrases. Keep these in mind. They truly make a difference. We're almost there, just a few sections left. For section 8, let's quickly cover some general instructions nurses often give to patients. These don't neatly fit into other categories, but they're very useful. You'll use these all the time for various procedures and tasks. Please lie down. Please lie down. Please sit up. Please sit up. Please turn on your side. Please turn on your side. Open your mouth, please. Open your mouth, please. Take this pill. Take this pill. Drink some water. Drink some water. Stand up, please. Stand up, please. Follow me, please. Follow me, please. Wait here, please. Wait here, please. One moment, please. One moment, please. Great work on those general instructions. These are everyday phrases that will come in handy in countless situations. Remember to always say please. It makes a big difference in how your instructions feel to the patient. We only have 2 categories left. Now let's change perspective. The next set of phrases is about talking to other nurses. Communication with your team is just as important as communication with patients. So let's dive in. Can you help me? Can you help me? I need help with this patient. I need help with this patient. We have a new patient in room 5. We have a new patient in room 5. Room 5 needs a blood test. Room 5 needs a blood test. Did you give the morning medication? Did you give the morning medication? The patient in room 5 has a fever. The patient in room 5 has a fever. Can you check on the patient? Can you check on the patient? Let's start the handover. Let's start the handover. I finished checking on the patients. I finished checking on the patients. I'll take a break now. I'll take a break now. Good communication with your co-workers keeps the ward running smoothly. Try to use clear and short phrases like these so everyone else understands. Leave a comment if you have other useful nurse-to-nurse phrases in mind or if you've already been using some of these. We're almost at the finish line, just one more category to go. Our final section will focus on talking to doctors. These phrases will help you communicate important information to physicians clearly and respectfully. Let's finish strong. The patient is in pain. The patient is in pain. Her blood pressure is low. Her blood pressure is low. He has chest pain. He has chest pain. She is having trouble breathing. She is having trouble breathing. He needs more pain medication. He needs more pain medication. The patient is asking for you. The patient is asking for you. Do you have any new orders? Do you have any new orders? The test results are back. The test results are back. I have a question about the patient. I have a question about the patient. The patient is getting worse. The patient is getting worse. You did it. You've learned 100 English phrases for beginner nurses. That was a lot of content, so well done for sticking with me to the end. Give yourself a round of applause. We've covered 100 phrases across 10 different topics, from giving a friendly greeting to ensuring patient safety to collaborating with your team. These phrases are your building blocks for effective communication in a hospital setting. Don't forget to download the accompanying guide for this video. It's a great way to review all the phrases and keep them handy. It's available for $4.99 or for student members as part of your membership. Also coming. Hi, I'm Jer from Learning English Pro, and this is 100 English phrases for medicine, medication, prescriptions, and patient instructions. This lesson is packed with clear professional phrases for healthcare workers like nurses, doctors, and pharmacists, from giving dosage instructions to explaining side effects. If you'd like to study these phrases in more detail, there is a full extensive guide for this lesson, which includes language tips for each phrase, a glossary, and 3 additional exercises to boost your comprehension. It's available to all my student members, and it's also available in the YouTube store for just $4.99. Let's get started. Our first category of phrases is prescribing medication. I'm prescribing you this medication for your symptoms. Take 1 tablet twice a day. This is a long-term medication for chronic conditions. You will need to take this medication regularly. This medication should help reduce your symptoms. I'll write you a prescription for pain relief. Start with a low dose and increase as needed. This medication is only available by prescription. You'll need a refill every month. Take it exactly as directed. Great start. These phrases are essential when prescribing medication. Next, let's talk about how to explain dosage and timing to patients. If you're finding these phrases helpful, hit the like button and subscribe for more. Take 1 pill every 8 hours. Take it on an empty stomach. You should take it before meals. Take it with plenty of water. Don't exceed 4 doses in 24 hours. Take this medication only when needed. Space out the doses evenly. Take it at the same time each day. If you miss a dose, take it as soon as you remember. Do not double the dose if you miss one. Well done. Clear instructions about dosage and timing are crucial for patient safety. Now, let's move on to discussing side effects. If you'd like to see more lessons like this, join the student membership to support the channel and get access to the guide that comes with this lesson. You may experience mild drowsiness. This medication might cause nausea. Contact us if you experience any side effects. Stop taking it if you develop a rash. Some patients report headaches. You may feel dizzy after taking this. Dry mouth is a common side effect. Rarely, it can cause blurred vision. Report any unusual symptoms immediately. Most side effects are temporary. Knowing how to explain side effects clearly helps patients manage their expectations. Up next, we'll cover administering medication. And leave a comment if you found any of these phrases useful so far. I'm going to give you an injection. This will be administered intravenously. We'll start the infusion slowly. You'll feel a small pinch. I'll insert the IV into your arm. The medication will be delivered through a drip. I'm going to adjust the dosage. We'll monitor you during the infusion. Let me know if you feel any discomfort. You might feel a slight burning sensation. Great job! Administering medication safely is key. Next, let's talk about patient instructions. And remember to subscribe for more professional medical English lessons. Take your medication exactly as prescribed. Do not share your medication with anyone. Keep your medication out of the reach of children. Store it at room temperature. Do not crush or chew the tablets. Follow the dosage instructions carefully. Finish the full course, even if you feel better. Take your medication with a meal if it upsets your stomach. Avoid alcohol while taking this. Keep a medication diary to track doses. Giving clear instructions helps patients stay safe and compliant. Next, let's discuss medication safety. Don't forget to give this video a thumbs up if you're finding it helpful. Always read the label before taking any medicine. Check the expiration date before use. Store in a cool, dry place. Keep your medication in its original packaging. Don't use if the seal is broken. Dispose of expired medication safely. Never mix medication without consulting a doctor. Avoid self-medicating without guidance. Keep a list of all your current medications. Inform us if you're taking herbal supplements. Wow, safety first. Now let's cover medication adherence and why it's so important. If you're still watching, leave a comment saying "got it" to let me know you're following along. Have you been taking your medication regularly? It's important not to skip doses. Let me know if you're having trouble sticking to your schedule. Use a pill organizer to stay on track. Set a reminder for your next dose. Don't stop the medication without consulting us. Consistency is key for effective treatment. Follow the treatment plan strictly. Keep track of your doses to avoid missed ones. Let us know if you're experiencing difficulty. Well done, you're doing awesome. Let's move on to our 8th topic, drug interactions. Inform your doctor about all the medications you are taking. Avoid combining this with alcohol. Do not take this medication with grapefruit juice. Some antibiotics may reduce the effectiveness of birth control. Check for potential interactions with your current medications. This medicine may interact with blood thinners. Let us know if you are taking any over-the-counter supplements. Be cautious when combining this with pain relievers. Consult your pharmacist about possible interactions. This medication can increase the effects of sedatives. Great, understanding drug interactions is crucial to patient safety. Now, let's move on to follow up on medication, which helps ensure ongoing care and effectiveness. If you want to explore these phrases even further, check out the guide for this lesson. It's full of additional language tips for every single phrase. The guide is available for student members over on the Student Membership tab, and it's also for sale in my YouTube store. How are you feeling after starting the new medication? Have you noticed any changes since beginning treatment? Are you experiencing any side effects? Have you been taking the medication as prescribed? Is the medication helping with your symptoms? Do you feel any improvements since the last visit? Are you having any trouble remembering to take your doses? Have you needed to use any additional pain relief? Would you like advice on managing your medication schedule? Let's review your medication plan together. Excellent. Following up on medication helps ensure that treatment is working as expected. Now, for our final section, if you got this far, well done. We're going to cover education and advice for medication. Always complete the full course, even if you feel better. Store your medication in a secure place. Keep a list of your medications in your wallet. Inform your pharmacist if you are pregnant or breastfeeding. Do not share your medication with anyone else. Educate yourself about possible side effects. Read the patient information leaflet thoroughly. Take your medication as directed to avoid complications. Contact us if you're unsure about your dosage. Keep a journal of your symptoms while on this medication. And that's it, 100 essential phrases for medication. I hope you found these phrases practical and useful for your work in healthcare. And if you'd like more in-depth explanations, check out the downloadable guide for this lesson. It includes a glossary and exercises to practice these phrases. It's available to student members for just $4.99 per month, which also grants you access to all my lesson guides, my video archive which contains 200 lessons, and much more. You can also get this guide as a one-time purchase in the YouTube store for $4.99. Did you know that over 3.6 billion diagnostic medical imaging scans are performed worldwide every year? That means that healthcare professionals like you need to understand and use medical imaging vocabulary accurately to communicate effectively with colleagues and patients. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. In today's lesson, we're learning 50 essential terms and phrases for radiology and medical imaging. These are the words and expressions you need when discussing scans, explaining procedures, and understanding imaging results, whether you're working with X-rays, MRIs, CT scans, or ultrasounds. This is the fourth episode in my healthcare vocabulary series. Previously, we covered mental health, physiotherapy, and phlebotomy. But don't worry if you missed these episodes, they are included right after this lesson on radiology and medical imaging, so just stay tuned to get all the vocabulary you need. And for my student members, I've created a PDF guide with all the terms from this lesson, plus additional exercises to help you revise and master the vocabulary. It's a great resource for OET and professional medical English learning. To join the student membership and boost your healthcare English skills, click the link in the video description. Now, let's get started with 50 terms for radiology and medical imaging. For each term that we look at today, you'll learn the pronunciation, the form, the definition, and I'll give you an example phrase so you'll be able to understand the context of the word. Medical imaging is essential for diagnosing and monitoring a wide range of conditions. Healthcare professionals must be familiar with different types of scans and their specific uses. X-ray. Repeat after me. X-ray. An X-ray is a radiographic image produced using ionizing radiation, commonly used to detect fractures and infections. Let's take a look at our example sentence. We'll take an X-ray of your chest to check for pneumonia. Let's move on to our next term. CT scan. CT scan. Otherwise known as computed tomography. This is a detailed imaging method that uses X-rays to create cross-sectional images of the body. The doctor ordered a CT scan to get a clearer picture of your abdomen. MRI, MRI, otherwise known as magnetic resonance imaging. This is a scan using magnetic fields and radio waves to create detailed images of soft tissues. You'll need to lie still during the MRI so we can get accurate images. Ultrasound, ultrasound. An ultrasound is an imaging technique that uses high-frequency sound waves to visualize internal structures. We're going to do an ultrasound to check your baby's development. Mammogram, mammogram. A mammogram is a specialized X-ray used to detect abnormalities in breast tissue. Your mammogram results will be reviewed by a specialist. Fluoroscopy, fluoroscopy. A fluoroscopy is a continuous X-ray technique that allows real-time imaging of movement in the body. The fluoroscopy will help us guide the catheter into position. Let's move on to DEXA scan. DEXA scan. Otherwise known as dual energy X-ray absorptiometry. This scan is used to measure bone density and assess osteoporosis risk. Let's check out our example. We're scheduling a DEXA scan to check for bone loss. Contrast imaging. Contrast imaging. Contrast imaging is a technique using a contrast agent to enhance the visibility of certain structures in scans. You'll need to drink a contrast liquid before your CT scan. PET scan. PET scan. Otherwise known as a positron emission tomography. This is a nuclear imaging technique used to observe metabolic activity in tissues. The PET scan will help us detect any abnormal cell activity. Angiography. Angiography. Angiography is a specialized imaging technique used to visualize blood vessels. Angiography will help us assess any blockages in your arteries. Radiology professionals use a variety of specialized equipment to capture clear and accurate images for diagnosis. Let's take a look at some of these in our next batch of terms. Radiograph. Radiograph. A radiograph is a medical image produced by X-rays. The radiograph shows a small fracture in your wrist. Scanner. Scanner. This is a general term for any machine that can capture medical images. Please step onto the scanner bed and we'll begin the process. Transducer. Transducer. This is the handheld device used in ultrasound imaging to send and receive sound waves. I'll apply some gel before using the transducer on your abdomen. Lead apron. Lead apron. A lead apron is a protective garment worn to shield against radiation exposure. We'll place a lead apron over you to protect your organs from radiation. Contrast dye. Contrast dye. This is a substance used to enhance the visibility of certain structures in scans. You may feel a warm sensation when the contrast dye is injected. Radiation shield. Radiation shield. A radiation shield is a protective barrier used to reduce radiation exposure. The radiation shield will protect you during the procedure. Imaging plate. Imaging plate. An imaging plate is a component of digital radiography that captures X-ray images. We need to replace the imaging plate before taking another scan. Collimator. Collimator. This is a device used in imaging machines to focus X-ray beams. The collimator helps minimize unnecessary radiation exposure. Barium swallow. Barium swallow. This is a diagnostic test using barium contrast to examine the esophagus. You'll need to drink this solution for the barium swallow test. Gamma camera. Gamma camera. A gamma camera is a device used in nuclear medicine to capture gamma radiation images. The gamma camera will track the radioactive tracer in your body. Our next set of terms are useful for radiology professionals when they must guide patients through procedures with clarity and to ensure a patient's comfort during imaging tests. Positioning. Positioning. Positioning is the process of placing a patient correctly for an imaging scan. I'll adjust your positioning so we get a clear image. Exposure time. Exposure time. This is the duration a patient is exposed to X-ray radiation. The exposure time will be brief to minimize radiation. Scan duration. Scan duration. Scan duration is the time required to complete a scan. The MRI scan duration will be about 30 minutes. Next up, we have a phrase. Hold your breath. Hold your breath. And this is a common instruction to patients during scans. Please hold your breath for a few seconds while we take the image. Lie still. Lie still. This phrase is an instruction given to prevent motion artifacts in imaging. Try to lie still so we can get a clear picture. Turn onto your side. Turn onto your side. This phrase is a command given during certain imaging procedures. Please turn onto your side for this next image. Contrast injection. Contrast injection. The contrast injection is the process of injecting a contrast agent into the patient. You might feel a slight flush when we administer the contrast injection. Monitor for reactions. Monitor for reactions. This phrase relates to checking for allergic responses to contrast dye. We'll monitor for reactions after the contrast is injected. Remove metal objects. Remove metal objects. Here we are giving patients a common pre-scan instruction to remove things like jewellery and belts. Please remove any metal objects before the MRI. Follow my instructions. Follow my instructions. This phrase is a general instruction given to patients during scans. Please follow my instructions carefully for the best results. Let's move on to our next topic. These terms are useful after imaging is completed, when medical professionals must accurately describe their findings to ensure proper diagnosis and treatment. Abnormality. Abnormality. An abnormality can be any unusual or unexpected change in structure or function seen on an imaging scan. The scan shows a small abnormality in the lower spine, which we need to investigate further. Lesion. Lesion. A lesion is a region of damaged or diseased tissue. The MRI revealed a lesion in the liver that requires further analysis. Fracture. Fracture. A fracture is a break or crack in a bone, often identified on an X-ray or CT scan. The X-ray confirmed a stress fracture in the patient's tibia. Nodule. Nodule. A nodule is a small mass or lump of tissue, often found in the lungs, thyroid, or other organs. The CT scan detected a pulmonary nodule in the right lung. Edema. Edema. An edema is a swelling caused by excess fluid in body tissues. The MRI indicates significant edema around the knee joint. Effusion. Effusion. This is the abnormal accumulation of fluid in a body cavity, often seen in the lungs or joints. The ultrasound shows a mild pleural effusion in the left lung. Calcification. Calcification. Calcification is the buildup of calcium in tissues, making them appear denser on scans. The mammogram shows calcification in the breast tissue, which needs further evaluation. Mass. Mass. In this context, a mass is a large abnormal growth or lump seen on an imaging scan. The MRI shows a mass in the abdomen, which may require a biopsy. Atrophy. Atrophy. Atrophy is a decrease in the size of an organ or tissue due to disease or lack of use. The MRI suggests muscle atrophy in the lower leg following prolonged immobility. Metastasis. Metastasis. This is the spread of cancer cells from the primary tumor to other parts of the body. The PET scan confirms metastasis to the liver and lymph nodes. In our final section, we'll be looking at adjectives and how we can use them to provide precise descriptive language, which can help radiologists and healthcare professionals communicate imaging results effectively. Our first adjective is benign. Benign. Benign means that something is not cancerous and generally not harmful. The scan shows a benign cyst that does not require treatment. Malignant. Malignant. A growth which is malignant is one which is cancerous and potentially aggressive. The biopsy confirms that the mass is malignant and requires further intervention. Enlarged. Enlarged. The adjective enlarged describes when something is bigger than normal in size, often indicating swelling or abnormal growth. The ultrasound detected an enlarged liver, which could suggest infection or disease. Opaque. Opaque. We use opaque to describe when something is not allowing radiation or light to pass through, often appearing white on X-rays. The chest X-ray shows an opaque area that could indicate pneumonia. Dense. Dense. This word describes having a high level of tissue or material compactness, making it appear whiter on scans. The mammogram reveals dense breast tissue, which may require further imaging. Irregular. Irregular. If something is irregular, it is uneven or asymmetrical in shape, often requiring further investigation. The MRI shows an irregular mass in the pancreas that needs further testing. Hyperintense. Hyperintense. If something is hyperintense, it is appearing unusually bright on an MRI scan, often indicating fluid or high protein content. The hyperintense region in the brain scan may suggest inflammation. Hypointense. Hypointense. Hypointense indicates something appearing darker than surrounding tissue on an MRI scan. The hypointense area in the kidney may indicate reduced blood flow. Diffuse. Diffuse. We can use this word to describe when something is spread out over a large area rather than being localized. The CT scan shows diffuse swelling in the abdominal cavity. Our final term for this lesson is well-defined. Well-defined. We can use this adjective term to describe when something is having a clear, distinct edge, which can indicate a non-aggressive or benign condition. The lesion appears well-defined, suggesting it is not malignant. Well done, you've just learned 50 essential terms for radiology and medical imaging, a crucial area of English for healthcare professionals. Remember, if you're a student member, you can download the full PDF guide with all the terms from today's lesson, plus additional exercises to help reinforce your learning. If you haven't joined yet and want to boost your healthcare English skills, just click the link in the video description to become a student member today. And stay tuned, don't go anywhere, because up next is another important lesson, 50 essential terms for mental health. Don't miss it, and see you in the next lesson. Healthcare is a field where communication is just as important as medical knowledge. Whether you're a doctor, nurse, therapist, or any healthcare professional, mastering English is key to building trust with patients, collaborating with colleagues, and excelling in your career. That's why I've created this healthcare vocabulary series, a deep dive into essential English terms used across different medical fields. Each lesson in this series is packed with tons of vocabulary phrases and professional language tips to help you sound natural and confident in any healthcare setting. Today's lesson is just one of many, and there's so much more to come. Hi, I'm Jer, and this is Learning English Pro, the channel for healthcare professionals to excel in English and advance in your careers. Today we're exploring 50 essential healthcare terms with the focus on mental health. Mental health is a critical part of patient care in all healthcare contexts, whether you're a psychologist, a therapist, nurse, doctor, or any professional working with patients. This lesson is packed with valuable vocabulary you'll use every day. For each of the 50 terms, you'll perfect your pronunciation, understand the meaning, and get real-life professional context with example sentences. This is a complete Cambridge-style English lesson designed to help you master meaning, form, and pronunciation for professional use. To take your learning even further, I've created a useful downloadable guide with all the vocabulary plus exercises for this lesson. It's available exclusively for my student members on the membership tab. Want access? You can join today and unlock this PDF plus so much more. The link to join is in the video description. Alright, enough business. Let's get straight into our 50 essential healthcare terms for mental health. Our first set of words focus on diagnostic terms. Our first word is neurodivergent. Repeat after me. Neurodivergent. This adjective describes individuals whose neurological development and functioning differ from societal standards of normal. Let's take a look at our example sentence. The patient identifies as neurodivergent, exhibiting traits consistent with autism spectrum disorder. Let's move on to bipolar disorder. Bipolar disorder. This is a mental health condition characterized by extreme mood swings, including manic and depressive episodes. The patient has been diagnosed with bipolar disorder and is currently experiencing a manic phase. Next up is schizophrenia. Schizophrenia. This word describes a severe mental disorder involving distorted thinking, perceptions, and a diminished ability to function. Early intervention is crucial in managing schizophrenia to improve long-term outcomes. Next up, we have obsessive-compulsive disorder, better known as OCD. This disorder is characterized by unwanted recurring thoughts or obsessions and repetitive behaviors or compulsions. Let's check out our example sentence. Cognitive behavioral therapy is effective in treating patients with obsessive-compulsive disorder. Another common disorder is post-traumatic stress disorder, better known as PTSD. This is a condition triggered by experiencing or witnessing a traumatic event, leading to severe anxiety and flashbacks. The veteran was diagnosed with PTSD following his return from active duty. Our next batch of words deals with symptomatic terms. Anhedonia. Repeat after me. Anhedonia. This noun describes an inability to experience pleasure from activities usually found enjoyable. The patient's anhedonia is a significant barrier to engaging in therapeutic activities. Affective flattening. Affective flattening. This term describes a reduction in the expression of emotions, often seen in facial expressions and voice tone. Affective flattening was observed during the mental status examination. Let's move on to our next term, hypervigilance. Hypervigilance. This is an enhanced state of sensory sensitivity and exaggerated awareness of surroundings. Hypervigilance in the patient suggests underlying anxiety issues. Our next word is rumination. Rumination. Rumination is the act of continuously thinking about the same thoughts, often negative, which can contribute to depression. Let's check out our example sentence. Addressing rumination is essential in the cognitive therapy of depression. Psychomotor agitation. Psychomotor agitation. This term describes unintentional and purposeless motions stemming from mental tension and anxiety. The patient's psychomotor agitation has decreased with the new medication regime. Our next topic is treatment-related terms. Psychopharmacology. Psychopharmacology. This is the study of the use of medications in treating mental disorders. Let's check out our example sentence. Advancements in psychopharmacology have improved outcomes for patients with mood disorders. Let's move on to cognitive behavioral therapy, better known as CBT. This is a type of psychotherapy that helps patients identify and change negative thought patterns and behaviors. CBT has been effective in reducing symptoms of anxiety and depression in adolescents. Next up, we have electroconvulsive therapy, also known as ECT. This is a medical treatment involving electrically induced seizures to treat severe mental disorders. ECT is considered when patients with severe depression do not respond to medication. Next up, we have mindfulness-based stress reduction, also known as MBSR. This is a therapeutic approach combining mindfulness meditation and yoga to reduce stress. MBSR programs have been integrated into treatment plans for patients with chronic anxiety. Let's move on to dialectical behavior therapy, also known as DBT. This is a form of therapy designed to help individuals manage intense emotions and reduce self-destructive behaviors. DBT is particularly effective for patients diagnosed with borderline personality disorder. Our next section deals with descriptive terms used in mental health care. Euthymic. Euthymic. This adjective pertains to a normal, stable mood state, neither depressed nor manic. Let's check out our example sentence. The patient has remained euthymic for several months with ongoing treatment. Let's move on to labile. Repeat after me. Labile. In mental health, labile describes emotions characterized by rapid and unpredictable changes. The patient's mood was labile, shifting from tears to laughter within minutes. Our next term is dysphoric. Dysphoric. Dysphoric is used to describe when a patient is experiencing a state of unease or generalized dissatisfaction. The patient reported a dysphoric mood throughout the past week. Psychosomatic. Psychosomatic. This term relates to physical symptoms caused or aggravated by mental factors. Stress can lead to psychosomatic symptoms such as headaches and stomach aches. Somatic. Somatic. And this adjective describes symptoms relating to the body, especially as distinct from the mind. The patient presented with somatic complaints, including fatigue and muscle pain. Our next batch of words relate to common behavioral terms used in mental health care. If you've been affected by any of the terms covered, please make sure to seek help from a professional. Self-harm. Self-harm. This is the act of deliberately inflicting pain or injury on oneself. The patient has a history of self-harm but denies any recent incidents. Suicidal ideation. Suicidal ideation. This is the presence of thoughts about or planning suicide without necessarily making an attempt. The patient reports experiencing passive suicidal ideation, but denies any intent or plan to act on it. Addiction. Addiction. Addiction is a compulsive dependency on a substance or behavior, often leading to harmful consequences. The patient's addiction to opioids has led to significant health complications. Compulsion. Compulsion. A compulsion is a repetitive, irresistible urge to perform a behavior, often linked to OCD. Hand washing has become a compulsion for the patient, interfering with daily activities. Delusion. Delusion. A delusion is a firmly held, false belief that is resistant to evidence or logic. The patient exhibits delusions of grandeur, believing they have supernatural abilities. Hallucination. Hallucination. This is a sensory perception that occurs in the absence of an external stimulus, often auditory or visual. Auditory hallucinations are a common symptom in schizophrenia. Derealization. Derealization. This is a feeling of detachment from one's surroundings, as if the external world is unreal. During periods of high anxiety, the patient experiences derealization, experiencing the world as dreamlike. Disassociation. Disassociation. This is a mental process where a person disconnects from thoughts, feelings, memories, or identity. The patient disassociates during stressful events, reporting memory gaps and emotional numbness. Hyperfixation. Hyperfixation. An intense and prolonged focus on a specific interest or activity, often linked to ADHD or autism. The patient describes hyperfixation on video games, leading to neglect of personal hygiene. Codependency. Codependency. Codependency is a behavioral condition where one person enables another's addiction or unhealthy behavior. The therapist is working with the patient to establish boundaries in their codependent relationship. Emotional dysregulation. Emotional dysregulation. This is difficulty managing emotional responses appropriately. Patients with borderline personality disorder often struggle with emotional dysregulation. In our next section, we're going to take a look at common mental health verbs. Diagnose. Diagnose. To diagnose is to identify a medical condition based on symptoms and tests. The psychiatrist diagnosed the patient with generalized anxiety disorder. Medicate. Medicate. To medicate is to administer medication as treatment. The patient was medicated with an SSRI to manage depressive symptoms. Prescribe. Prescribe. This verb means to authorize the use of specific medication or treatment. The doctor prescribed an antidepressant to help regulate mood. Stabilize. Stabilize. This word means to bring a patient's condition to a steady, controlled state. The goal is to stabilize the patient's mood swings through therapy and medication. Let's move on to regress. Regress. To regress is to revert to a previous, less advanced state of mental or emotional well-being. After discontinuing therapy, the patient showed signs of emotional regression. Suppress. Suppress. This word means to reduce or inhibit a mental or emotional response. The medication helps suppress intrusive thoughts in patients with OCD. Our next term is to cognitively reframe. Cognitively reframe. And this means to shift perspective on a thought or belief to reduce stress. Cognitive reframing is a key technique in treating negative thought patterns. Disclose. Disclose. To disclose means to reveal or share personal information, often in a therapeutic setting. The patient was hesitant to disclose past trauma, but gradually opened up. Reinforce. Reinforce. To reinforce means to strengthen a behavior or thought pattern, either positively or negatively. Therapists use positive reinforcement to encourage healthy coping strategies. Validate. Validate. To validate is to acknowledge and affirm someone's emotions or experiences. It's important to validate the patient's feelings before offering solutions. In our final section, we're going to take a look at medications and therapy-related terms used in mental health care. First up, we have SSRI, or selective serotonin reuptake inhibitor. This is a class of antidepressants that increase serotonin levels in the brain. Let's take a look at our example sentence. SSRIs, like fluoxetine, are commonly prescribed for depression and anxiety disorders. Anxiolytic. Anxiolytic. An anxiolytic is a medication that reduces anxiety. The patient was prescribed an anxiolytic to manage panic attacks. Mood stabilizer. Mood stabilizer. A mood stabilizer is a type of medication that helps balance mood fluctuations, often used in bipolar disorder. Lithium is a widely used mood stabilizer for bipolar disorder. Neuroleptic. Neuroleptic. Neuroleptic is another term for antipsychotic medication used to treat conditions like schizophrenia. Neuroleptics can help manage symptoms of psychosis but may have side effects. Exposure therapy. Exposure therapy. Exposure therapy is a psychological treatment that involves gradual exposure to anxiety triggers to reduce fear. Exposure therapy has been highly effective for patients with phobias. Trauma-informed care. Trauma-informed care. This is an approach that recognizes and responds to the impact of trauma in patient care. Trauma-informed care ensures that the patient feels safe and respected in therapy. Somatic therapy. Somatic therapy. Somatic therapy is a therapeutic approach that focuses on the connection between mind and body in processing trauma. Somatic therapy techniques like grounding exercises help patients reconnect with their bodies. Psychosocial intervention. Psychosocial intervention. This is a non-medical approach to improving mental health through social and behavioral strategies. Group therapy is a common form of psychosocial intervention. Mindfulness meditation. Mindfulness meditation. This is a practice that involves focusing on the present moment to improve mental well-being. Mindfulness meditation is integrated into therapy to help manage stress and anxiety. Holistic psychiatry. Holistic psychiatry. This is an approach that combines conventional psychiatry with alternative and complementary methods. Holistic psychiatry considers lifestyle, diet, and emotional well-being alongside medication. Well done, you've just completed this lesson on 50 essential healthcare terms for mental health. This is just the beginning. There's so much more to learn in the healthcare vocabulary series. And don't go anywhere because coming up next is our next batch of 50 healthcare terms. And this time the topic is physiotherapy. Did you know that 80% of adults will experience back pain at some point in their lives, and that rehabilitation professionals, including physiotherapists, are in higher demand than ever? If you're preparing for the OET exam, working in rehabilitation, or simply looking to improve your medical English, mastering the right vocabulary is crucial. Hi, I'm Jer, and this is Learning English Pro, the channel where healthcare professionals like you excel in English and advance in their careers. Today, we're diving into 50 essential healthcare vocabulary terms, with a focus on physiotherapy, movement, and rehabilitation. This lesson comes from a student member request. And if you're a student member of Learning English Pro, your requests get priority. Plus, you'll get a handy downloadable guide with each lesson. The one for this lesson includes all the vocabulary from this lesson, fun exercises to test your knowledge, and links to additional medical English guides from Learning English Pro. If you want access to these exclusive materials, the link to join is in the video description. Alright, enough business. Let's get started with 50 key healthcare vocabulary terms for physiotherapy. We'll cover pronunciation, form, meaning, and context, just like a real Cambridge English lesson. Let's begin. First up, we're going to look at nouns relating to physiotherapy. And our first term is joint stability. Repeat after me. Joint stability. This term refers to the ability of a joint to maintain proper alignment during movement. Let's take a look at our example sentence. Joint stability is essential for athletes to prevent injuries during sports. Let's move on to our next term, which is muscle atrophy. Muscle atrophy. Muscle atrophy is the wasting away or decrease in muscle mass due to inactivity. Extended bed rest can lead to muscle atrophy, making rehabilitation more difficult. Tendinitis. Tendinitis. This is the inflammation of a tendon, often caused by repetitive motion. The runner developed tendinitis from overtraining without proper rest. Let's move on to myofascial release. Repeat after me. Myofascial release. This is a therapy technique used to relieve muscle tightness and pain. Myofascial release techniques can help reduce tension in tight muscles. Our next term is gait analysis. Gait analysis. This is the study of a person's walking pattern to detect abnormalities. Let's check out our sentence example. Gait analysis showed that the patient was favoring one leg after surgery. Our sixth noun is ergonomics. Ergonomics. Ergonomics is the science of designing workspaces to reduce strain and injury. Good ergonomics in the workplace can prevent chronic back pain. Prosthesis. Repeat after me. Prosthesis. A prosthesis is an artificial body part, such as a limb or joint replacement. After losing his leg in an accident, he was fitted with a prosthesis. Let's move on to orthotics. Orthotics. Orthotics are custom-designed inserts or devices to support and align the feet. She wears orthotics in her shoes to support her arches and prevent pain. Our next term is balance board. Balance board. A balance board is a tool used in therapy to improve stability and coordination. The therapist recommended using a balance board to improve coordination. Spinal alignment. Spinal alignment. This refers to the correct positioning of the spine to prevent pain and injury. Spinal alignment is crucial for reducing chronic back and neck pain. Compression bandage. Compression bandage. A compression bandage is a tight wrap used to reduce swelling and support injured areas. The doctor applied a compression bandage to control the swelling. Kinesiology tape. Kinesiology tape. This is a flexible tape used to support muscles and reduce pain. Kinesiology tape helps support the athlete's knee during recovery. Neuroplasticity. Neuroplasticity. This refers to the brain's ability to reorganize itself by forming new connections. Neuroplasticity allows stroke patients to regain lost motor functions. Our next term is TENS, which stands for transcutaneous electrical nerve stimulation. And this refers to a device that uses electrical impulses for pain relief. The patient uses a TENS machine to manage chronic pain in his lower back. Biomechanics. Biomechanics. Biomechanics is the study of human movement and mechanics. Let's look at our example sentence. Biomechanics helps us understand how different movements affect the body. Rehabilitation Center. Rehabilitation Center. This is a medical facility focused on recovery from injury or surgery. He spent 3 months in a rehabilitation center after his knee surgery. Soft tissue therapy. Soft tissue therapy. This is a treatment that involves manipulation of muscles and tendons. Soft tissue therapy reduced the tension in his shoulders and neck. Motor control. Motor control. Motor control is the ability to regulate and direct movement. Motor control exercises helped the patient regain movement in his arm. Let's move on to bursitis. Bursitis. This is an inflammation of the fluid-filled sacs that cushion joints. Bursitis in her shoulder made lifting heavy objects painful. Our 20th noun is the term scar tissue. Scar tissue. Scar tissue is thickened fibrous tissue that forms after an injury or surgery. Scar tissue formed after the surgery, affecting her range of motion. Well done, that's 20 nouns relating to physiotherapy and movement. And next up, we're going to take a look at some verbs relating to physiotherapy and movement, so get ready. All the definitions I give will be in the context of physiotherapy and movement. The first verb we will look at is mobilize. Mobilize. Mobilize means to move a joint or muscle to restore function. And let's take a look at our example sentence. The therapist mobilized the patient's stiff ankle to improve flexibility. Strengthen. Strengthen. Strengthen means to build up muscle power and endurance. Resistance exercises help strengthen weak muscles after an injury. Let's move on to retrain. Retrain. And this word means to teach a body part to function again after injury. The patient had to retrain his walking pattern after a stroke. Contract. Contract. As a verb, contract means to tighten a muscle actively. He was instructed to contract his abs during the exercise. Stabilize. Stabilize. In physiotherapy, to stabilize means to make steady or maintain proper alignment. Bracing techniques help stabilize her injured knee. Activate. Activate. This means to engage a muscle group during movement. The exercise activates the glutes and improves lower body strength. Realign. Realign. This word means to restore correct positioning of bones or joints. The chiropractor realigned his spine to relieve pressure on the nerves. Next up, we have elongate. Elongate. This word means to stretch or lengthen a muscle. Stretching helps elongate muscles and improve flexibility. Rehabilitate. Rehabilitate. This word means to restore strength and function after an injury. The clinic specializes in rehabilitating sports-related injuries. Engage. Engage. To engage means to actively use a muscle group. Engaging the core is crucial for proper posture during exercise. Next up, we have loosen. Loosen. And this means to reduce stiffness or tightness in muscles or joints. Massage therapy helped loosen tight muscles in his back. Reprogram. Reprogram. This means to train the nervous system to adapt to new movement patterns. Stroke patients need to reprogram their nervous system for movement recovery. Reinforce. Reinforce. This means to strengthen a movement or posture through repetition. The therapist reinforced proper walking techniques through repetition. Optimize. Optimize. To optimize means to improve efficiency and effectiveness in movement. Optimizing movement patterns can enhance athletic performance. Prevent. Prevent. To prevent means to take steps to avoid injury or deterioration. Wearing proper footwear can prevent ankle injuries. That's all the verbs we're going to cover. Next, let's move on to some adjectives relating to physiotherapy and movement. Our first adjective is weight-bearing. weight bearing. And this term describes something supporting body weight while standing or moving. Weight-bearing exercises strengthen bones and muscles. Our next term is the opposite of weight-bearing, non-weight-bearing. Non-weight-bearing. This adjective can be used to describe an injured limb which has to avoid any pressure. After surgery, he was on a non-weight-bearing protocol for 6 weeks. Pain-free. Pain-free. We use this term to describe when one is without any discomfort or pain. She was relieved when her knee became pain-free after treatment. Progressive. Progressive. We use this term to describe when something like an injury or condition increases in difficulty or intensity over time. Let's check out our example sentence. The therapist used a progressive approach to increase exercise intensity. Isolated. Isolated. We use the term isolated when something like an exercise is targeting a specific muscle or movement. Isolated muscle exercises target specific weak areas. Controlled. Controlled. This term describes when something is done with precision and focus. Controlled movements help prevent injuries during rehabilitation. Unstable. Unstable. Unstable describes a situation or maybe a person's movement which is lacking balance or stability. An unstable surface forces the body to engage stabilizing muscles. Compensatory. Compensatory. Compensatory is used to describe situations where adjusting movements are made to make up for a weakness. Compensatory movements can indicate muscle imbalances. Inflamed. Inflamed. If something is inflamed, it is swollen and painful due to an irritation. Her wrist was inflamed after overuse at work. Restricted. Restricted. In physiotherapy, we can use restricted to describe a patient who is limited in movement or range of motion. The cast made her ankle movement restricted. Let's move on to optimal. Optimal. Optimal describes the best possible condition for function or recovery. The patient reached an optimal recovery state after months of therapy. Symmetrical. Symmetrical. Symmetrical is used to describe when conditions are even and balanced on both sides of the body. A symmetrical gait is important for proper walking mechanics. Overactive. Overactive. We use overactive to describe a person or perhaps muscles which are working excessively, often leading to strain. Overactive muscles can cause tightness and discomfort. And next we have the opposite of overactive, underactive. Underactive. And similarly, this describes a person or maybe muscles which are not working enough, and it can lead to muscle weakness. An underactive glute can lead to poor hip stability. Our final adjective and final word for this lesson is resilient. Resilient. To be resilient is to be able to recover quickly and adapt to movement. A resilient mindset helps patients recover faster from injuries. Well done, you've just learned 50 essential healthcare vocabulary terms focused on physiotherapy, movement, and rehabilitation, a huge step in improving your medical English. Student members, don't forget to download your guide packed with all the terms, exercises, and links to additional resources. If you're not a member yet but want to access, click the link in the video description. What if there was a series that explored medical vocabulary in detail, giving you not just words but pronunciation, form, definition, and real life context? Well, I've got you covered. Hi, I'm Jer, and welcome to Learning English Pro, the channel for healthcare professionals like you to excel in English and advance in your career. In today's lesson, we'll explore 50 essential terms for healthcare with the focus on phlebotomy. Whether you're a nurse, doctor, or any healthcare professional, this lesson will help you communicate clearly and confidently in a medical setting. We'll go through each term just like a real Cambridge English lesson, covering pronunciation, word form, definition, and example sentences and context. To help my student members practice and reinforce what they learn, I've created a PDF guide for this lesson, which includes all the terms, definitions, and content, plus additional exercises to improve your understanding. As a student member of Learning English Pro, you get a new guide with every new lesson. If you'd like to join, the link is in the video description. Alright, let's get started with 50 essential phlebotomy terms for healthcare professionals. To start, let's cover some essential syringe-related terms. These are tools used in injections, blood draws, and sample collection. Understanding their names and functions will help you communicate clearly in a medical setting. Our first term is needle. Needle. Needle is a synonym which is commonly used interchangeably with syringe. Though technically, the needle is just one part. It is the sharp metal tip that penetrates the skin. Let's take a look at our example sentence. A 23 gauge needle is commonly used for blood collection. Let's move on to hypodermic syringe. Repeat after me. Hypodermic syringe. This is a syringe with a fine needle used for subcutaneous or intramuscular injections. Hypodermic syringes are commonly used for vaccines. Vacuum tube. Vacuum tube. A vacuum tube is used for blood collection, often instead of a traditional syringe. For venipuncture, we usually use a vacuum tube system. Auto-injector. Auto-injector. This is a device that administers a dose automatically without the need for manual injection. An epinephrine auto-injector is used for severe allergic reactions. Barrel. Barrel. The barrel is the cylindrical body of a syringe that holds the liquid. Check the barrel to ensure the correct dosage. Bevel. Bevel. This is the angled tip of the needle that facilitates smoother insertion. Insert the bevel facing up for a less painful injection. Hub. Hub. The hub is the base of the needle that attaches to the syringe. Twist the hub securely to attach the needle. Our next term is luer lock. Luer lock. And this is a type of syringe tip that allows the needle to be securely twisted on. Luer lock syringes help prevent accidental detachment of the needle. slip tip, slip tip. This is a simple push-on connection for needles. Slip tip syringes allow quick and easy needle attachment. Safety cap, safety cap. A safety cap is a protective cover for the needle to prevent accidental injuries. Always replace the safety cap before disposal. Now let's move on to key equipment and terms used in phlebotomy. From blood collection tubes to centrifuges, these are the tools and concepts every healthcare professional should know. Tourniquet, tourniquet. A tourniquet is a band used to constrict blood flow to make veins more prominent. Apply the tourniquet about 3 inches above the puncture site. Venipuncture, venipuncture. This is the process of inserting a needle into a vein to draw blood. Proper venipuncture technique reduces the risk of complications. Butterfly needle, butterfly needle. This is a small needle with flexible tubing for delicate veins. Use a butterfly needle for patients with fragile veins. Lancet, lancet. A lancet is a small, sharp tool used to puncture the skin for capillary blood collection. A lancet is commonly used for glucose testing. Vacutainer, vacutainer. A vacutainer is a blood collection system that includes a tube, needle, and holder. Let's have a look at our example. Choose the correct vacutainer tube based on the required test. Centrifuge, centrifuge. This is a machine used to separate blood components. Place the blood samples in the centrifuge for proper separation. Our next term is serum. Serum. Serum is the liquid portion of blood that remains after clotting. The lab requires a serum sample for the test. Plasma, plasma. Plasma is the fluid part of blood that contains clotting factors. Unlike serum, plasma contains fibrinogen. Hematoma, hematoma. A hematoma is a localized collection of blood outside blood vessels. A hematoma may form if pressure is not applied correctly. Capillary, capillary. This is a tiny blood vessel where blood is collected from the finger or heel. Capillary blood is often used for rapid glucose testing. Anticoagulant, anticoagulant. An anticoagulant is a substance that prevents blood clotting. Heparin is an anticoagulant used in certain blood tests. Hemolysis, hemolysis. This is the breakdown of red blood cells, which can often affect test results. Avoid shaking the tube forcibly to prevent hemolysis. Needle stick injury, needle stick injury. This is an accidental puncture by a used needle. Report any needle stick injury immediately to the supervisor. Gauge. Gauge. Gauge is the thickness of a needle. Smaller numbers indicate a larger needle. A 21 gauge needle is commonly used for routine blood draws. Evacuation tube. Evacuation tube. A vacuum-sealed container used for blood collection. Select the appropriate evacuated tube based on the test ordered. Phlebotomy isn't just about equipment, it's about actions. In this section, we'll focus on important verbs used during blood collection and handling, ensuring you understand the correct terminology for each step of the procedure. Palpate. Palpate. To palpate is to feel with the hands, in this case, to locate veins. Always palpate the vein before inserting the needle. Anchor. Anchor. This verb means to hold the vein steady before puncture. Use your non-dominant hand to anchor the vein. Insert. Insert. This means to introduce the needle into the vein. Gently insert the needle at a 15-degree angle. Withdraw. Withdraw. Withdraw means to remove the needle from the vein. Slowly withdraw the needle once blood collection is complete. Invert. Invert. This means to gently mix blood with the additive in the tube. Invert the tube 5 to 10 times to ensure proper mixing. Label. Label. To label means to mark the blood sample with patient details. Always label the sample immediately after collection. Dispose. Dispose. To dispose means to discard needles and biohazardous waste safely. Dispose of used needles in the sharps container. Recollect. Recollect. This means to draw blood again if the first sample is inadequate. A hemolyzed sample may require you to recollect the blood. Aspirate. Aspirate. In this case, aspirate means to pull back on the syringe to check for blood return. Never aspirate when using a vacuum collection system. Apply. Apply. And this means to place pressure or a bandage on the puncture site. Apply firm pressure to prevent bruising. To describe veins, needles, and blood samples accurately, you need the right adjectives. This section will help you use precise language when assessing patients and handling samples. Our first adjective is fragile. Fragile. And this describes something which is easily damaged, often used to describe veins. Let's take a look at our example. Elderly patients often have fragile veins. Superficial. Superficial. This describes something located near the surface, like a vein, making it easier to access. Use a superficial vein for easier blood collection. Deep, deep. This describes a vein which is situated far below the skin's surface. Some patients have deep veins that require ultrasound guidance. Next up, we have clotted. Clotted. Clotted describes blood that has solidified. A clotted sample cannot be used for a coagulation test. Sterile. Sterile. If something is sterile, it is free from bacteria or contamination. Always use a sterile needle for venipuncture. Finally, let's look at common phrases used in phlebotomy. These collocations are essential for giving instructions, explaining procedures, and ensuring smooth communication with patients and colleagues. Locate a vein. Locate a vein. This means to identify a suitable vein for venipuncture. Use a warm compress to help locate a vein in difficult cases. Confirm patient identity. Confirm patient identity. And of course, this means to verify the patient's details before drawing blood. Always confirm patient identity before collecting a sample. Apply a tourniquet. Apply a tourniquet. And this means to restrict blood flow and make veins more visible. Apply a tourniquet for no longer than 1 minute. Insert the needle. Insert the needle. And this means to puncture the vein with the needle. Slowly insert the needle at the correct angle. Draw blood. Draw blood. This common phrase means to collect a blood sample. Use the correct technique to draw blood efficiently. Remove the tourniquet. Remove the tourniquet. This means to release the restriction after blood flow is established. Remove the tourniquet before withdrawing the needle. Prevent hemolysis. Prevent hemolysis. And this means to prevent breaking red blood cells. Handle the sample carefully to prevent hemolysis. Dispose of sharps. Dispose of sharps. This phrase means to safely discard needles and other sharp instruments. Always dispose of sharps in designated containers. Fill the tube. Fill the tube. This means to allow blood to flow into the collection tube. Hold the tube at an angle to fill the tube correctly. Check for bleeding. Check for bleeding. And this final phrase means to ensure the puncture site is still not bleeding. After removing the needle, check for bleeding and apply pressure. Well done! You've just learned 50 essential terms for phlebotomy, covering tools, procedures, and common phrases used in medical settings. Student members, don't forget to download the PDF guide for this lesson. It includes all the vocabulary from this lesson plus exercises to reinforce your learning. You can access it by joining as a student member. The link is in the video description. Feeling nervous about the OET speaking test? Don't worry, I've got you covered. In this lesson, we're diving into the exact tips, strategies, and confidence boosters you need to ace your role-play scenarios as a dentist. From building rapport with patients to handling unexpected questions like a pro, you'll leave this video ready to impress the examiners and succeed. Your OET success story begins right here. Hi, I'm Jer, and welcome to Learning English Pro, the channel for healthcare professionals like you to excel in professional English and pass the occupational English test like a pro. Today, we are looking at the OET speaking test for dentists, covering the test structure, practical tips for role-play scenarios, and strategies to communicate clearly and confidently. Get ready to master English phrases and actionable practice steps to help you ace your exam. And stick around after this lesson because I'm including 2 additional lessons for dentistry in English. Explore dentist vocabulary and phrases, and then explore patient phrases for a dental appointment. This is your OET Dentist Masterclass for speaking. Student members of my channel should head over to the membership tab to download the exclusive PDF guide for this lesson. It includes all the tips and strategies along with additional role-play cards for dentist scenarios in the OET test. If you're not a member of my student membership, why not? It's full of great perks to help you boost your OET English skills. The link to join right now is in the video description. Let's get started. Let's cover some practical tips first. Arrive at least 30 minutes before your test to avoid stress and get familiar with the environment. Dress professionally. While it's not a formal interview, dressing smartly helps you feel confident and professional. You'll need to understand the format. There are 2 role plays. Each begins with 3 minutes to read and prepare, followed by a 5-minute role play. But don't worry, we'll break it down further in the lesson. Arriving a little bit earlier gives you some preparation time to calm yourself, review your notes, and think about the flow of the upcoming conversations. The speaking examination will begin with a brief informal chat for about 2 or 3 minutes with the examiner. This will allow you to get relaxed and comfortable. In this chat, it is likely you'll be asked simple questions about your work or professional background. This part is not scored and does not contribute to your final grade. It's important to understand the structure of the role-play tasks. There are 2 scenarios you must participate in. Each role-play conversation will run for about 5 minutes, and you will have 3 minutes to prepare for each scenario. For the preparation, you'll be given a role-play card, and as I mentioned, you will have 3 minutes to review and prepare. Let's take a look at one. So what do you need to focus on when you get this card? We need to make sure we are showing empathy with the patient and building rapport, or a good relationship. Explaining medical terms in simple language is essential. We also need to keep the patient at the center of the conversation, asking open-ended questions and checking that they understand. And you need to do all of this in the required time limit. So this covers our approach to the task. But what are we being tested on? And of course, being an English test, key linguistic skills will be observed and marked by your examiner, but also your clinical communication skills. Are you friendly to your patients? Approachable? Are you providing clear information, focusing on patient needs? And do you have a beginning, middle, and end, and a clear structure to the consultation or conversation? Don't worry, it's a lot, but I will show you how to do all of this in a moment. In the scenario, the examiner will play the role of a patient, a caregiver, or sometimes another health professional. You will be playing the role of a dentist, or perhaps another healthcare professional if applicable. Let's go back to that role-playing card and break down how to prepare for the role play. By the way, if you want to take a closer look at this role-play card along with more examples, you can access it on the student members PDF guide for this lesson. First up, check the setting and your role. Ensure you have the correct type of scenario for your examination. Next, take a look at the patient's key issues and concerns. In this case, the patient has a severe toothache in the upper right molar for the past week. That is the key issue. The patient has some nervousness about treatment and cost. So, while your clinical approach will see you addressing the pain and treatment for this patient, the additional twist is that you must also be considerate of their situation and feelings. The task list provides you with everything you need to approach the conversation. What is clear straight away is that you should begin with a focus on gathering information from the beginning. I'll show you phrases for this in a moment. Then it's all about communicating diagnosis and treatment with the patient, with the context of their concerns being fully addressed. In this case, the pain of the treatment, fear of root canal treatment, and the cost of treatment. Ensuring to check patient understanding and showing empathy and reassurance throughout the role play scenario. The end of the conversation should focus on aftercare, expectations, instructions, recovery time, and follow-up appointments as necessary. It sounds like a lot to consider, but remember, you are already a capable professional doing this every day with patients in your own language. And next, I'll show you lots of English phrases for you to practice and perfect your OET speaking. When it comes to beginning the role play, we immediately begin to build rapport with the patient. This will help make them comfortable, but also help you feel comfortable too. Where possible, use the patient's name. This is a great personal touch. Hi, I'm Dr. Smith. I understand you've been experiencing some pain. Can you tell me a bit more about it? Once the patient starts to detail their key issues, it's time for you to gather as much information as possible. Ask targeted questions about the patient's symptoms relating to duration, severity, and things that might trigger the issue. When did the pain start? On a scale of 1 to 10, how severe is the pain? Does the pain get worse when you eat or drink something hot or cold? When it comes to explaining the causes of the issue and providing a diagnosis, it is 100% essential to simplify medical terminology for the patient. Describe terms in everyday English. My key for this approach is clarity. Be clear and keep it simple. Empathy. Don't overwhelm the patient with dental jargon. Be professional. Stay calm and be confident. The pain could be due to a cavity, infection, or inflammation, and an X-ray will help us confirm the cause. If it's an infection, a root canal will clean the infected tissue inside the tooth and seal it to prevent further damage. Let's take a look at more ways we can avoid jargon to be clearer for your patient. Instead of, you have pulpitis in your molar, say, it looks like the soft tissue inside your tooth is inflamed, which is causing the pain. Instead of saying endodontic therapy involves cleaning the root canals, say a root canal is a procedure to clean the infected area inside your tooth and seal it to prevent further damage. You need to be able to anticipate what the patient may ask you about. Questions will obviously be about the issue, but will also involve their concerns. In this case, nervousness and the financial cost of the treatment. Stay confident. This helps keeping the patient reassured. Discuss costs and provide flexible payment options if relevant. And remember, always be kind and empathetic. This helps to make the patient feel seen, respected, and understood. Some great terms you can use to show kindness are, I see. That must be very difficult. I understand. Let's get you as comfortable as possible. Don't worry, you are in good hands. We'll ensure you're completely numb during the procedure, so you won't feel any pain. I understand that dental procedures can feel intimidating. I'll guide you through every step and ensure you're comfortable. We'll discuss payment options that work for you. So you're doing great and covering all the bases so far. Now it's time to wrap up the conversation by summarizing what you've discussed with the patient and going over aftercare procedures. We summarize to ensure patient understanding, and this helps us lead into talking about the next steps with aftercare. Aftercare covers recovery and dietary restrictions, as well as follow-up appointments. Remember, you are still keeping language simple to avoid overwhelming the patient. Let's take a look at how we can summarize everything for a patient. So, to summarize, the pain in your upper molar is likely caused by an infection in the tooth. We'll confirm this with an X-ray and then proceed with a root canal to clean and seal the tooth. This will stop the pain and protect the tooth from further damage. You'll be completely numb during the procedure, so you won't feel any pain. Afterward, you might experience some mild discomfort, which can be managed with painkillers. And for aftercare, we also have some great phrases by topic. For pain management, you may feel some mild soreness for 1 to 2 days, but over-the-counter painkillers like ibuprofen should help. Dietary restrictions. Avoid hard, crunchy, or sticky foods for at least 48 hours. Stick to soft foods like soup, mashed potatoes, or yogurt. Oral hygiene. Continue brushing your teeth, but be gentle around the treated area. Avoid flossing near the tooth for a couple of days. And for a follow-up appointment, we'll schedule a follow-up visit in a week to check your healing and finalize the treatment, such as placing a crown if needed. If the patient requires help, if you experience severe pain, swelling, or fever after the procedure, contact us immediately. All that's left to do is close the conversation. Here, the main task is to ensure the patient leaves the consultation feeling informed, reassured, and confident in their next steps. You're in great hands, and this treatment will help eliminate the pain and protect your tooth. If you have any questions or concerns after the procedure, don't hesitate to reach out. Let's book your follow-up appointment now, and we'll also provide written aftercare instructions for you to take home. By following my instructions, you'll have the perfect role-play scenario. But what if things don't go to plan? Nobody's perfect, and anyone can make a mistake or forget something in a pressurized environment like an examination. So let's run through some tips for when things don't go to plan. First of all, don't panic. You already have the answer. Think back to your notes and your preparation time. You did a great job in those 3 minutes. Think about what is useful to you in that moment. If you don't know what to say, try and keep the conversation moving by asking the patient a relevant question or summarizing what you've discussed so far. Just to confirm, you mentioned the pain worsens with hot drinks. Is that correct? If you think you've said something unclear, use these phrases to rephrase or clarify. Let me rephrase that for you. What I meant was, let me explain that in a different way. If you think you said the wrong thing or the patient seems confused or asks for clarification, acknowledge this calmly and provide further explanation.
I'm not sure I understand what a root canal is.
I apologize for any confusion. A root canal is a procedure where we clean the inside of the tooth to remove the infection and then seal it to prevent further issues. If you are going blank, buy yourself some time. Use these fillers to keep things moving along and give yourself time to recover. That's a great question. Let me think about the best way to explain this. Let's take a moment to go over this together. Stay calm and positive. Remember, you know the answer. Let's quickly recap what we've covered today. First, we discussed how to prepare for the OET speaking exam by understanding the role play structure and using your preparation time effectively. Then we explored strategies for building rapport, explaining procedures clearly, and addressing patient concerns. Finally, we talked about handling unexpected challenges and keeping the conversation smooth and professional. Student members, don't forget to download your exclusive guide for this lesson, filled with additional exercises to boost your OET speaking. Want to join and get lots of amazing perks? Click the link in the description now. Childbirth is one of the most powerful moments in life, and as a midwife, your words can make it safer, calmer, and more human. Hi, I'm Jer from Learning English Pro, the channel for healthcare professionals like you to improve your English and grow in your career. Today's lessons will give you 100 English phrases that are useful in maternity care, from early pregnancy all the way to birth and aftercare. We'll go through 10 key topics, each with 10 phrases. You'll learn how to communicate with mothers during prenatal checkups, labour, and recovery, and how to explain common procedures, how to support someone in pain, and how to speak clearly during emergencies. There's even a section on speaking with partners and other professional communication with your team. If you'd like to download the full guide, you can get it as part of my student membership. Student membership with Learning English Pro gives you access to all my PDF guides. There's over 70 now, 200 exclusive English lessons, and the chance to request content on the English topics you need. Membership is just $4.99 per month. Or if you want to buy the guide as a one-time download, you can get it in my YouTube store. This video also includes several additional medical English lessons after the 100 phrases. You can find all the timestamps in the video description. Are you ready to begin? Let's jump in with our first topic, which is prenatal care. You'll hear each phrase twice. For more detailed explainers, check the guide that comes with the lesson. How far along are you now? How far along are you now? Please roll up your sleeve. Please roll up your sleeve. I'm going to check your blood pressure now. I'm going to check your blood pressure now. Do you have any concerns or questions you'd like to discuss? Do you have any concerns or questions you'd like to discuss? Have you noticed any unusual symptoms, such as bleeding or headaches? Have you noticed any unusual symptoms, such as bleeding or headaches? Let's listen to the baby's heartbeat. Let's listen to the baby's heartbeat. Everything looks good with the baby so far. Everything looks good with the baby so far. We need to take a blood sample for some tests. We need to take a blood sample for some tests. Remember to take your prenatal vitamins every day. Remember to take your prenatal vitamins every day. Your blood pressure and weight are looking good. Your blood pressure and weight are looking good. Well done. These first 10 phrases are core tools for clear, caring communication during prenatal visits. Let's have a quick test. Which phrase would you use to gently invite the patient to speak freely about their worries? Did you get it? The correct answer is, do you have any concerns or questions you'd like to discuss? If you're finding this lesson helpful, hit the like and subscribe. I release new medical English content every week. Next, we're heading into the delivery room with phrases to support mothers through labour and birth. You're fully dilated now. It's time to start pushing. You're fully dilated now. It's time to start pushing. Take a deep breath and push as hard as you can. Take a deep breath and push as hard as you can. Push when you feel the urge. push when you feel the urge. One more big push. You're doing great. One more big push. You're doing great. Okay, stop pushing and take short breaths. Okay, stop pushing and take short breaths. I can see the baby's head. You're almost there. I can see the baby's head. You're almost there. Just a few more pushes and your baby will be here. Just a few more pushes and your baby will be here. Take a quick rest between contractions if you can. Take a quick rest between contractions if you can. One more push for the shoulders. Almost done. One more push for the shoulders. Almost done. You did it. The baby is here. You did it. The baby is here. That was an intense section, but don't worry, we're going to come back to this section later on in the video with even more phrases. These phrases that we've just covered are essential for guiding and supporting a mother through the most physically demanding stage of a pregnancy. Now, quick quiz. Which phrase would you use when the baby's head is visible and you want to encourage the mother to keep going? Got it? The correct answer is, I can see the baby's head. You're almost there. Don't forget, you can download the full PDF guide for this lesson as a student member or pick it up in my YouTube store. Now, let's explore the days after delivery with phrases for postnatal care and recovery. How are you feeling now, physically and emotionally? How are you feeling now, physically and emotionally? Let's check your bleeding and make sure everything looks normal. Let's check your bleeding and make sure everything looks normal. Try to rest whenever the baby is sleeping. Try to rest whenever the baby is sleeping. Let me know if you're in any pain so we can manage it. Let me know if you're in any pain so we can manage it. You're doing really well. It's completely normal to feel overwhelmed. You're doing really well. It's completely normal to feel overwhelmed. I'm just going to check your stitches now. I'm just going to check your stitches now. You may feel some cramping. That's the uterus shrinking. You may feel some cramping. That's the uterus shrinking. Let's talk about feeding options. What are your thoughts? Let's talk about feeding options. What are your thoughts? Here's how to hold a baby for feeding. I'll guide your hand. Here's how to hold the baby for feeding. I'll guide your hand. We'll keep an eye on your vitals for the next few hours. We'll keep an eye on your vitals for the next few hours. Great job. These postnatal phrases help create a safe, supportive recovery environment and show that emotional care matters too. Let's try a quick quiz. Which phrase could you use to explain why the mother might be feeling cramps? Did you get it right? The correct answer is, you may feel some cramping. That's the uterus shrinking. What's been your favorite phrase so far? Let me know which one you're most likely to use first in the comments below, and let me know where you're watching from in the world. I love to hear from my international students. Now let's move on into more urgent territory with phrases used in emergency situations. We're going to keep a close eye on this, and I'll stay right here with you. We're going to keep a close eye on this, and I'll stay right here with you. Your bleeding is heavier than expected. We're going to act quickly. Your bleeding is heavier than expected. We're going to act quickly. We're calling the doctor now to assess the situation. We're calling the doctor now to assess the situation. Take some deep breaths. We've got you. Take some deep breaths. We've got you. We're giving you something for the pain now. We're giving you something for the pain now. The baby needs some help, so we're calling the pediatric team. The baby needs some help, so we're calling the pediatric team. You're in safe hands, and we're doing everything we can. You're in safe hands, and we're doing everything we can. Would you like me to hold your hand? Would you like me to hold your hand? We're going to theatre now. Everything is ready. We're going to theatre now. Everything is ready. Your baby is okay. They're getting the care they need. Your baby is okay. They're getting the care they need. That was a powerful section. Being able to speak with clarity and kindness during an emergency can make all the difference. Here's your next quick question. Which phrase lets the mother know you're calling in the doctor for support? And yes, the correct answer is we're calling the doctor now to assess the situation. If you'd like more insight on each of the phrases, remember the guide for this lesson includes an explanation for each of the 100 phrases, and it's available now to my student members over on the membership tab. If you want to join the student membership, click the button beneath this video or check out the details in the video description. Now it's time for topic 5 already. Well done for getting this far. Our next batch of phrases deal with explaining medical procedures in a clear, simple way. I'm going to do a quick examination now. I'm going to do a quick examination now. You might feel some pressure, but it shouldn't be painful. You might feel some pressure, but it shouldn't be painful. I'll be as gentle as possible. Please tell me if it's uncomfortable. I'll be as gentle as possible. Please tell me if it's uncomfortable. I'm inserting the speculum now. Try to take some slow breaths. I'm inserting the speculum now. Try to take some slow breaths. This is going to feel cold for a moment. This is going to feel cold for a moment. We're going to monitor the baby's heartbeat for a while. We're going to monitor the baby's heartbeat for a while. You may feel a little pinch as I take the sample. You may feel a little pinch as I take the sample. We'll send this to the lab and get the results soon. We'll send this to the lab and get the results soon. I'm putting in the IV now, just a small sting. I'm putting in the IV now, just a small sting. We'll explain everything again before the procedure starts. We'll explain everything again before the procedure starts. Those last 10 phrases help midwives clearly guide patients through medical procedures, and that clarity can ease anxiety and help build trust. Here's your question. Which phrase would you use before inserting a speculum? And of course, the answer is 44. I'm inserting the speculum now. Try to take some slow breaths. This is a really great phrase for preparing the patient for some uncomfortableness. If you found this lesson helpful so far, don't forget to subscribe so you never miss a medical English class. Coming up next, phrases to support someone through pain and distress with kindness and professionalism. I know this is painful. You're doing so well. I know this is painful. You're doing so well. Try to breathe through it, nice and slow. Try to breathe through it, nice and slow. Would you like to change position? Would you like to change position? Let's try using the birth ball to help ease the pressure. Let's try using the birth ball to help ease the pressure. You're not alone. I'm right here with you. You're not alone. I'm right here with you. It's okay to cry or shout, whatever you need. It's okay to cry or shout, whatever you need. Take one contraction at a time. Take one contraction at a time. Would you like to hold someone's hand? Would you like to hold someone's hand? This part is the toughest, but you're nearly there. This part is the toughest, but you're nearly there. Let's try some gentle touch or massage, if that's okay. Let's try some gentle touch or massage, if that's okay. You are doing such incredible work. These phrases help midwives provide both physical and emotional care when it matters most. Okay, quiz time. Which phrase offers calm encouragement during a contraction? Did you get it? The correct answer is try to breathe through it nice and slow. Now, let's move on to one of the most underrated areas, communicating with the partner or support person. Would you like to stay close and support them? Would you like to stay close and support them? They're doing well, just breathing through the contraction. They're doing well, just breathing through the contraction. You can remind them to breathe and hold their hand if you want. You can remind them to breathe and hold their hand if you want. Let me know if you need a break and I'll stay with them. Let me know if you need a break and I'll stay with them. It's normal for them to make sounds or feel overwhelmed. It's normal for them to make sounds or feel overwhelmed. Would you like a chair or a drink of water? Would you like a chair or a drink of water? You're doing great. Just being here makes a big difference. You're doing great. Just being here makes a big difference. Do you have any questions about what's happening right now? Do you have any questions about what's happening right now? Let me explain what you might see during the next stage. Let me explain what you might see during the next stage. You're welcome to step outside if you need a moment. You're welcome to step outside if you need a moment. Those last 10 phrases are so important. A calm, informed partner helps the mother and you more than you might realize. Here's your quick quiz question. Which phrase offers the partner a clear way to help without pressure? The correct answer is, you can remind them to breathe and hold their hand if you want. If you find that this lesson is supercharging your English, please give it a like and tell a colleague. We've got 3 more powerful sections coming up. Now let's focus on communication with the wider medical team. Can someone assist me here, please? Can someone assist me here, please? Let's review the birth plan before we start. Let's review the birth plan before we start. Vitals are stable, no changes from earlier. Vitals are stable, no changes from earlier. Could you prepare the meds while I set up the monitor? Could you prepare the meds while I set up the monitor? Patient is 6 centimeters and contracting every 3 minutes. Patient is 6 centimeters and contracting every 3 minutes. Let's debrief after this and make sure everything's documented. Let's debrief after this and make sure everything's documented. Can you double check her file for allergies? Can you double check her file for allergies? Let's call for the anaesthetist now. She's asking for an epidural. Let's call for the anaesthetist now. She's asking for an epidural. Do you want to escalate or wait another 10 minutes? Do you want to escalate or wait another 10 minutes? We'll update the family once we've stabilized everything here. We'll update the family once we've stabilized everything here. Fantastic work! These phrases make you a better team player, calm, clear, and always focused on patient safety. Which of these phrases would you use to update a colleague on labour progress? The correct answer is, patient is 6 centimeters and contracting every 3 minutes. If you're finding this all very helpful, why not explore student membership? You'll get full access to the PDF version of the guide for this lesson, along with my complete library of guides and additional English lessons. You'll join my community and really start to boost your professional English. Okay, let's head into our second last section now, phrases for guiding someone through birth itself. This section follows on from topic 2. The baby is coming soon. You're doing brilliantly. The baby is coming soon. You're doing brilliantly. Keep breathing just like that. You've got it. Keep breathing just like that. You've got it. Try to push down into the pressure when the contraction comes. Try to push down into the pressure when the contraction comes. You're going to feel a strong urge to push. That's normal. You're going to feel a strong urge to push. That's normal. Let's try a new position to give the baby more space. Let's try a new position to give the baby more space. That was great. Now just rest and breathe between contractions. That was great. Now just rest and breathe between contractions. You're in control. Listen to your body. You're in control. Listen to your body. We're almost there. One more good push. We're almost there. One more good push. You might feel some burning. That means the head is crowning. You might feel some burning. That means the head is crowning. Here's your baby. You did it. Here's your baby. You did it. Amazing job. These phrases help guide one of the most powerful moments in someone's life with professionalism and care. Which of these phrases is used when the head is crowning? And yes, the correct answer is phrase number 89. You might feel some burning. That means the head is crowning. We're almost at the finish line. For our final topic, let's focus on phrases midwives use to empower, comfort, and support mothers throughout the journey. You're stronger than you think. You're stronger than you think. Everything you're feeling is completely valid. Everything you're feeling is completely valid. You're allowed to feel scared. I'm here with you. You're allowed to feel scared. I'm here with you. Every birth is different. There's no right way to feel. Every birth is different. There's no right way to feel. It's okay to ask for help. That's what we're here for. It's okay to ask for help. That's what we're here for. You're doing more than enough. You're doing more than enough. You don't have to be perfect. Just breathe. You don't have to be perfect. Just breathe. There's no rush. Take your time. There's no rush. Take your time. You're not alone. We're with you every step. You're not alone. We're with you every step. You've done something incredible. You've done something incredible. Wow, congratulations! You've just completed 100 English phrases for midwives, a full masterclass in real, compassionate professional language for maternity care. If you've enjoyed this lesson, why not get the PDF guide, which is available right now for my student members? Student membership comes with loads of additional benefits, including my full PDF guide directory, which includes over 70 professional English guides. You'll also gain access to 200 English lessons on YouTube for my members only. And got an idea for an English professional lesson? Let me know. Your request gets priority as a student member. You can also pick up the guide in my YouTube store for just $4.99 as a one-time purchase. Now, hello and welcome back to Learning English Pro. In this lesson, we're going to cover medical conversation listening. You'll hear 5 short conversations between a nurse and a doctor. Each conversation will play twice. The second time, you will see 2 questions on screen related to the conversation you're hearing. Use these questions to test your listening skills and challenge your comprehension. There are 10 questions in total, so write your score in the comments. The full transcripts for all conversations are available through the student membership for Learning English Pro. It's just $4.99 per month. Members get access to PDF guide downloads, my video library, early access, priority requests, and additional content. This is Learning English Pro, English skills for ambitious careers. If you find this lesson helpful, like, subscribe, and hit the notification bell so you never miss a new lesson. Leave a comment with your score and let me know how you did. Let's get started.
Dr. James, sorry to disturb you. I've just been in to check on Mr. LeBlanc in room 14. He's really agitated and disoriented. I'm a bit concerned.
No problem, Priya. What's happening with him exactly?
Well, he didn't recognize me. Thought he was still in the operating theater. He kept saying he was late for his surgery and trying to get out of bed, even though he's got a catheter in. His vitals are stable, but his heart rate is slightly elevated.
That sounds like post-operative delirium. Has he had any pain relief recently?
Yes, he had 5 milligrams of morphine at around 3 a.m. He's due for another dose in about an hour, but I'm not sure if it's helping or making things worse. Last night he was relatively calm.
It could be a reaction to the morphine. Sometimes it can cause confusion, especially in older patients. Has he had a similar reaction before?
Actually, yes. His chart notes some mild confusion after his gallbladder surgery last year, but nothing this severe.
Okay, let's reassess his medication plan. I think we should hold off on the next morphine dose and switch to paracetamol IV for now. We'll see if reducing the opioids helps stabilize his mental state.
That sounds good. I'll make the note and inform the night staff. Do you think we should run any other tests?
Let's do a quick set of bloods to rule out any infection. Sometimes post-op confusion can be linked to something underlying, like a UTI or electrolyte imbalance.
I can collect the urine sample now and send it to the lab along with the bloods. Should we also check his hydration status?
Definitely. Dehydration could be a factor. Can you monitor his fluid balance over the next few hours?
Of course. I'll record his input and output, and we'll monitor his vitals closely.
Great. Let's also make sure he's in a calm environment. Lights dimmed, minimal noise. Sometimes overstimulation can worsen delirium.
I'll make sure the curtains are drawn and reduce the noise level. Should I also inform his family about his confusion?
Yes, it's a good idea. Explain that this can happen after surgery and that we're actively managing it. Reassure them that it's usually temporary.
Understood. I'll give them a call and update them. Thanks for discussing this with me. I really appreciate the support.
No problem at all. You're doing great work. Let's catch up in an hour and see how he's doing.
Will do. Thanks, Doctor. Dr. James, sorry to disturb you. I've just been in to check on Mr. LeBlanc in room 14. He's really agitated and disoriented. I'm a bit concerned.
No problem, Priya. What's happening with him exactly?
Well, he didn't recognize me. Thought he was still in the operating theater. He kept saying he was late for his surgery and trying to get out of bed, even though he's got a catheter in. His vitals are stable, but his heart rate is slightly elevated.
That sounds like post-operative delirium. Has he had any pain relief recently?
Yes, he had 5 milligrams of morphine at around 3 a.m. He's due for another dose in about an hour, but I'm not sure if it's helping or making things worse. Last night he was relatively calm.
It could be a reaction to the morphine. Sometimes it can cause confusion, especially in older patients. Has he had a similar reaction before?
Actually, yes. His chart notes some mild confusion after his gallbladder surgery last year, but nothing this severe.
Okay, let's reassess his medication plan. I think we should hold off on the next morphine dose and switch to paracetamol IV for now. We'll see if reducing the opioids helps stabilize his mental state.
That sounds good. I'll make the note and inform the night staff. Do you think we should run any other tests?
Let's do a quick set of bloods to rule out any infection. Sometimes post-op confusion can be linked to something underlying, like a UTI or electrolyte imbalance.
I can collect the urine sample now and send it to the lab along with the bloods. Should we also check his hydration status?
Definitely. Dehydration could be a factor. Can you monitor his fluid balance over the next few hours?
Of course. I'll record his input and output, and we'll monitor his vitals closely.
Great. Let's also make sure he's in a calm environment. Lights dimmed, minimal noise. Sometimes overstimulation can worsen delirium.
I'll make sure the curtains are drawn and reduce the noise level. Should I also inform his family about his confusion?
Yes, it's a good idea. Explain that this can happen after surgery and that we're actively managing it. Reassure them that it's usually temporary.
Understood. I'll give them a call and update them. Thanks for discussing this with me. I really appreciate the support.
No problem at all. You're doing great work. Let's catch up in an hour and see how he's doing.
Will do. Thanks, doctor.
Dr. Khan, I'm really sorry to bother you, but the portable ECG is acting up again. That's the third time today. I restarted it twice, but it just shows a blank screen.
You've got to be kidding. We had that machine serviced just last month. Which patient are we talking about?
It's Mr. Simmons in bed 5. He's reporting chest tightness and shortness of breath. I tried switching to the backup machine, but it's not charged.
All right, let's not waste any more time. We need to get him on a monitor immediately. Can we transfer him to the main ward for continuous monitoring?
I've called the porters, but they said it would take about 15 minutes. I thought about using the stationary monitor in Bay 3 instead.
Good thinking. Let's move him ourselves. We can't afford to wait that long. I'll help you transfer him.
Thanks. I've already prepared oxygen and aspirin, just in case. His vitals are stable for now, but he seems anxious.
Good call. Anxiety could be a factor here. Make sure to reassure him as we move. Once we get him settled, I'll do a quick physical exam.
Got it. I'll explain to him that we're just being cautious and that moving to Bay 3 is standard procedure.
Perfect. Let's also notify the cardiac team. If his symptoms worsen, we might need their input.
I'll do that right away. Do you think it's worth filing another maintenance request for the ECG machine?
Definitely. This is a recurring issue and it's impacting patient care. Let's document the problem and escalate it to the equipment manager.
I feel like this happens way too often. Sometimes I worry we're just patching up problems instead of solving them.
I hear you. It's frustrating, but for now, let's focus on Mr. Simmons. You've handled this well, keeping calm and proactive.
Thanks. I just hate feeling unprepared when equipment fails.
That's completely understandable. You did the right thing by acting quickly and thinking on your feet. Let's follow up with maintenance after this.
Okay, I'll start the transfer now. Thanks for being so supportive.
We're a team. Let's make sure Mr. Simmons is comfortable and reassured.
Dr. Khan, I'm really sorry to bother you, but the portable ECG is acting up again. That's the third time today. I restarted it twice, but it just shows a blank screen.
You've got to be kidding. We had that machine serviced just last month. Which patient are we talking about?
It's Mr. Simmons in bed 5. He's reporting chest tightness and shortness of breath. I tried switching to the backup machine, but it's not charged.
All right, let's not waste any more time. We need to get him on a monitor immediately. Can we transfer him to the main ward for continuous monitoring?
I've called the porters, but they said it would take about 15 minutes. I thought about using the stationary monitor in Bay 3 instead.
Good thinking. Let's move him ourselves. We can't afford to wait that long. I'll help you transfer him.
Thanks. I've already prepared oxygen and aspirin, just in case. His vitals are stable for now, but he seems anxious.
Good call. Anxiety could be a factor here. Make sure to reassure him as we move. Once we get him settled, I'll do a quick physical exam.
Got it. I'll explain to him that we're just being cautious and that moving to Bay 3 is standard procedure.
Perfect. Let's also notify the cardiac team. If his symptoms worsen, we might need their input.
I'll do that right away. Do you think it's worth filing another maintenance request for the ECG machine?
Definitely. This is a recurring issue and it's impacting patient care. Let's document the problem and escalate it to the equipment manager.
I feel like this happens way too often. Sometimes I worry we're just patching up problems instead of solving them.
I hear you. It's frustrating, but for now, let's focus on Mr. Simmons. You've handled this well, keeping calm and proactive.
Thanks. I just hate feeling unprepared when equipment fails.
That's completely understandable. You did the right thing by acting quickly and thinking on your feet. Let's follow up with maintenance after this.
Okay, I'll start the transfer now. Thanks for being so supportive.
We're a team. Let's make sure Mr. Simmons is comfortable and reassured.
Dr. Lee, could I have a quick word? It's about the central line placement for Mr. Turner in bed 7.
Of course, Fatima. What's on your mind?
I didn't want to say anything in front of the intern earlier, but I noticed that he broke the sterile field. His glove brushed the monitor cable while adjusting the line, and he didn't change gloves. I wasn't sure how to address it at the time.
Thanks for telling me. That's definitely a concern. Was the patient exposed to any open wounds during the procedure?
Not directly. The insertion site was still covered, but I'm worried about contamination. I was debating whether to speak up during the procedure, but I didn't want to undermine him.
It's a tricky situation, and I appreciate your discretion. In those cases, it's always better to prioritize patient safety, even if it feels uncomfortable. I would have backed you up if you had mentioned it.
Next time, I'll say something immediately. I just didn't want to disrupt his focus.
That's understandable. If it helps, we can arrange a quick debrief with him so he knows for next time. I'll make sure it's supportive, not critical.
That would be really helpful. I also wondered if we should do anything preventative for Mr. Turner since there's a potential contamination risk.
Good thinking. Let's start with close monitoring of the site for any signs of infection, redness, swelling, or discharge. We can also mark it in the notes so that everyone is aware.
Should we consider starting prophylactic antibiotics just to be safe?
Since the risk is relatively low, I'd prefer to hold off and monitor first. If anything develops, we can reassess. What's your gut feeling on his overall condition?
He's stable, but a bit anxious after the procedure. I reassured him that everything went smoothly, but I'll keep an eye on his vitals.
Sounds good. I'll follow up with the intern. We'll approach it as a learning point, and I'll make sure he knows you acted in the patient's best interest.
Thank you for handling it so professionally. I really value that.
And I value your judgment. You did the right thing by raising this. Let's make sure Mr. Turner remains stable.
Dr. Lee, could I have a quick word? It's about the central line placement for Mr. Turner in bed 7.
Of course, Fatima. What's on your mind?
I didn't want to say anything in front of the intern earlier, but I noticed that he broke the sterile field. His glove brushed the monitor cable while adjusting the line, and he didn't change gloves. I wasn't sure how to address it at the time.
Thanks for telling me. That's definitely a concern. Was the patient exposed to any open wounds during the procedure?
Not directly. The insertion site was still covered, but I'm worried about contamination. I was debating whether to speak up during the procedure, but I didn't want to undermine him.
It's a tricky situation, and I appreciate your discretion. In those cases, it's always better to prioritize patient safety, even if it feels uncomfortable. I would have backed you up if you had mentioned it.
Next time, I'll say something immediately. I just didn't want to disrupt his focus.
That's understandable. If it helps, we can arrange a quick debrief with him so he knows for next time. I'll make sure it's supportive, not critical.
That would be really helpful. I also wondered if we should do anything preventative for Mr. Turner since there's a potential contamination risk.
Good thinking. Let's start with close monitoring of the site for any signs of infection, redness, swelling, or discharge. We can also mark it in the notes so that everyone is aware.
Should we consider starting prophylactic antibiotics just to be safe?
Since the risk is relatively low, I'd prefer to hold off and monitor first. If anything develops, we can reassess. What's your gut feeling on his overall condition?
He's stable, but a bit anxious after the procedure. I reassured him that everything went smoothly, but I'll keep an eye on his vitals.
Sounds good. I'll follow up with the intern. We'll approach it as a learning point, and I'll make sure he knows you acted in the patient's best interest.
Thank you for handling it so professionally. I really value that.
And I value your judgment. You did the right thing by raising this. Let's make sure Mr. Turner remains stable.
Dr. Kamal, can I talk to you for a moment? It's about Mrs. O'Neill's daughter.
Of course. What's going on?
She's really struggling. Even though we discussed the palliative care plan yesterday, she keeps insisting that we do more. She's asking for more tests and a second opinion.
That's understandable. Sometimes acceptance takes time. Did she say what specifically she's worried about?
She kept repeating, "You're giving up on her." I tried to explain that we're focused on comfort now, but it didn't seem to reassure her.
That's tough. Sometimes families feel helpless when there's no active treatment. Did you ask her what she thinks doing more would look like?
Yes, she mentioned trying a different medication. She even asked if we could transfer her mother to another hospital. I didn't want to outright say it wasn't possible.
You did the right thing by listening. I can call her and go over the plan again. Sometimes hearing it from both of us can help.
That might work. I just worry about how much we can really say without making promises.
It's a fine line. We can acknowledge her feelings without giving false hope. I'll explain that the team is constantly reassessing to ensure her mother's comfort.
Should we involve palliative care again to help address her concerns?
Yes, let's get them on board. They're skilled at guiding families through this. Also, let's document the family's concerns so it's clear that we're being thorough.
Good idea. I'll make a note in the file after we speak to her. Do you think we should set up a follow-up meeting with the family?
Absolutely. Maybe a family conference where we can discuss the plan in a supportive environment. That way, they know we're still actively involved in her care.
I can arrange that. I'll also spend some time with Mrs. O'Neill to make sure she's comfortable and talk to her a bit.
Great. Let's keep reassuring both the patient and the family. You're handling this really well.
Thanks, Doctor. I just want to make sure I'm doing right by the family while keeping realistic expectations.
You are. Balancing empathy and honesty is never easy, but you're doing it with compassion.
Dr. Kamal, can I talk to you for a moment? It's about Mrs. O'Neill's daughter.
Of course. What's going on?
She's really struggling. Even though we discussed the palliative care plan yesterday, she keeps insisting that we do more. She's asking for more tests and a second opinion.
That's understandable. Sometimes acceptance takes time. Did she say what specifically she's worried about?
She kept repeating, "You're giving up on her." I tried to explain that we're focused on comfort now, but it didn't seem to reassure her.
That's tough. Sometimes families feel helpless when there's no active treatment. Did you ask her what she thinks doing more would look like?
Yes, she mentioned trying a different medication. She even asked if we could transfer her mother to another hospital. I didn't want to outright say it wasn't possible.
You did the right thing by listening. I can call her and go over the plan again. Sometimes hearing it from both of us can help.
That might work. I just worry about how much we can really say without making promises.
It's a fine line. We can acknowledge her feelings without giving false hope. I'll explain that the team is constantly reassessing to ensure her mother's comfort.
Should we involve palliative care again to help address her concerns?
Yes, let's get them on board. They're skilled at guiding families through this. Also, let's document the family's concerns so it's clear that we're being thorough.
Good idea. I'll make a note in the file after we speak to her. Do you think we should set up a follow-up meeting with the family?
Absolutely. Maybe a family conference where we can discuss the plan in a supportive environment. That way, they know we're still actively involved in her care.
I can arrange that. I'll also spend some time with Mrs. O'Neill to make sure she's comfortable and talk to her a bit.
Great. Let's keep reassuring both the patient and the family. You're handling this really well.
Thanks, Doctor. I just want to make sure I'm doing right by the family while keeping realistic expectations.
You are. Balancing empathy and honesty is never easy, but you're doing it with compassion.
Dr. Alvarez, can I just grab you for a second? It's about Mr. Chow's discharge meds.
Of course, Jasmine. What's the issue?
His chart says he's on 20 milligrams of lisinopril, but the discharge form only lists 10 milligrams. I didn't want to send him home with the wrong dose, so I held off processing it.
Good catch. Let me double-check his medical record. Sometimes the electronic system pulls outdated information.
That's what I thought too. The form looks like it's from his last admission, not the current one.
You're right. The system pulled up his previous discharge plan. It should be 20 milligrams as per his latest treatment adjustment. Thanks for spotting that.
No problem. Do you want me to call pharmacy and have it corrected?
Yes, please. Make sure they update it on his electronic file, too. We don't want this to repeat next time he's admitted.
Will do. Do you think it's worth noting in his chart that the error was caught before discharge?
Absolutely. Documenting that is essential. It shows due diligence and highlights that the error was identified before any risk to the patient.
I'm glad I caught it. I nearly missed it because the previous dose was on top.
It happens. The important thing is you trusted your instincts and double-checked. I really appreciate that.
Thanks. I just don't like the idea of a patient going home with the wrong dose, especially with lisinopril. It could have caused some serious issues.
Exactly. Blood pressure management is crucial. I'll make a note for the pharmacy manager to review the electronic template. It shouldn't be pulling outdated data like that.
That would help. It's not the first time I've seen this happen. Maybe they could add a prompt to double-check previous admissions.
Great idea. Let's suggest that in the next team meeting. Meanwhile, let's get Mr. Chow sorted so he can go home safely.
I'll update the file and give pharmacy a quick call. I'll also explain to Mr. Chow that we've double-checked his meds.
Good plan. Make sure he knows it's all sorted before he leaves. You've done great work on this.
Thanks. I just want to make sure everything's right. I'll follow up on the pharmacy update, too.
Perfect. Let me know if you need any more support.
Dr. Alvarez, can I just grab you for a second? It's about Mr. Chow's discharge meds.
Of course, Jasmine. What's the issue?
His chart says he's on 20 milligrams of lisinopril, but the discharge form only lists 10 milligrams. I didn't want to send him home with the wrong dose, so I held off processing it.
Good catch. Let me double-check his medical record. Sometimes the electronic system pulls outdated information.
That's what I thought, too. The form looks like it's from his last admission, not the current one.
You're right. The system pulled up his previous discharge plan. It should be 20 milligrams as per his latest treatment adjustment. Thanks for spotting that.
No problem. Do you want me to call pharmacy and have it corrected?
Yes, please. Make sure they update it on his electronic file, too. We don't want this to repeat next time he's admitted.
Will do. Do you think it's worth noting in his chart that the error was caught before discharge?
Absolutely. Documenting that is essential. It shows due diligence and highlights that the error was identified before any risk to the patient.
I'm glad I caught it. I nearly missed it because the previous dose was on top.
It happens. The important thing is you trusted your instincts and double-checked. I really appreciate that.
Thanks. I just don't like the idea of a patient going home with the wrong dose, especially with lisinopril. It could have caused some serious issues.
Exactly. Blood pressure management is crucial. I'll make a note for the pharmacy manager to review the electronic template. It shouldn't be pulling outdated data like that.
That would help. It's not the first time I've seen this happen. Maybe they could add a prompt to double-check previous admissions.
Great idea. Let's suggest that in the next team meeting. Meanwhile, let's get Mr. Chow sorted so he can go home safely.
I'll update the file and give pharmacy a quick call. I'll also explain to Mr. Chow that we've double-checked his meds.
Good plan. Make sure he knows it's all sorted before he leaves. You've done great work on this.
Thanks. I just want to make sure everything's right. I'll follow up on the pharmacy update, too.
Perfect. Let me know if you need any more support.
Great job completing this medical conversation listening English lesson. Remember, practicing listening skills like this can make a huge difference in your professional communication. Don't forget to share your score in the comments below. I'd love to hear from you and how you got on. Did you know that over 80% of medical errors result from miscommunication? For nurses, clear and confident English isn't just helpful, it's essential. Hi, I'm Jer and this is Learning English Pro, the channel where healthcare professionals like you come to excel in English and advance in your careers. Today, we're diving into 100 brand new English phrases for nurses, covering everything from patient care and modern healthcare challenges to digital communication and mental health support. These aren't just any phrases, they reflect real-world nursing situations, helping you sound professional and natural in English. And don't forget, there is a PDF guide for this lesson which is exclusively available to my student members. It's a fantastic learning tool to use alongside this video. So if you're serious about improving your English, especially for healthcare, consider joining. The link is in the video description. There are two ways to enjoy this lesson. If you're an active learner, select the topic of your choice from the timestamps in the video description. Grab a pen and paper and think about how you can incorporate these English phrases into your everyday work. Maybe you're a passive listener, so put this lesson on in the background and go about your day. This is a great way to pick up listening on the go and engage your natural listening skills. Okay, let's get started on our lesson. Our first topic is welcoming and initial assessment. Let's get you checked in. Do you have your insurance card with you? With this phrase, we are welcoming the patient and ensuring that all necessary documentation is in place before proceeding with their care. Can you verify your personal information for me? Here we are confirming the patient's details to ensure that their medical records are accurate and up to date. Do you have any recent travel history? This question is used to assess whether the patient has been in areas with potential health risks, such as infectious disease outbreaks. Have you been exposed to any contagious illnesses recently? By asking this, we are screening the patient for possible exposure to illnesses that may require special precautions. What concerns would you like to discuss today? This phrase invites the patient to share their main reason for seeking medical care, ensuring their needs are addressed properly. Are you experiencing any unusual symptoms? With this question, we encourage the patient to describe anything out of the ordinary that could assist in diagnosing their condition. Do you have any mobility issues I should be aware of? This helps us determine whether the patient requires special assistance or adjustments to their care plan. Have you recently undergone any medical procedures? Here we are checking for any recent surgeries or treatments that might be relevant to their current condition. Do you have any cultural or religious preferences we should consider in your care? This phrase acknowledges the patient's personal values, ensuring that their cultural and religious needs are respected. Have you received your latest vaccinations? By asking this, we verify whether the patient is up to date on important immunizations, which can be crucial for their health. Let's move on to the next topic, which is taking vital signs and monitoring. I'm going to check your blood sugar levels now. This informs the patient that a glucose test will be performed, which is especially important for diabetic care. Let me place this pulse oximeter on your finger. Here we are letting the patient know that we will be measuring their oxygen saturation levels using a small device. Your oxygen levels are slightly low. Let's monitor them closely. With this statement, we reassure the patient that we are keeping a close eye on their respiratory function. I need to take your respiratory rate. This informs the patient that we will be measuring how many breaths they take per minute, an important indicator of lung health. Your heart rate is irregular. I'll inform the doctor. By saying this, we acknowledge an unusual finding and ensure the patient that their case will be escalated to a physician. I'll take another reading in a few minutes to confirm. This reassures the patient that any unusual readings will be double-checked for accuracy. Let's check your hydration levels. This phrase lets the patient know that we will assess whether they are adequately hydrated, which is crucial for their overall health. I'm monitoring you for any signs of dehydration. Here we explain that we are paying attention to symptoms such as dry skin or dizziness that may indicate fluid loss. Let me check your pupil response to light. This informs the patient that we are performing a neurological check to assess their brain function. I'll need to perform a quick neurological assessment. With this phrase, we prepare the patient for a simple set of tests that will evaluate their nervous system. Our third topic is modern medication and pain management. We'll start with the non-opioid pain relief option. Here we explain that the first line of treatment will be a pain reliever that does not contain opioids, reducing the risk of dependence. This medication is part of an updated treatment plan. By saying this, we clarify that the patient's treatment has been adjusted for better effectiveness. Have you taken any over-the-counter medications today? This question helps us determine whether the patient has already taken something that might interact with their prescribed medication. We're switching your medication due to potential interactions. Here we explain that a change has been made to avoid harmful drug interactions. This is a long-acting pain reliever. With this phrase, we let the patient know that their medication is designed to provide relief over an extended period. We'll monitor for any potential allergic reactions. This reassures the patient that we will be observing them for any signs of an allergic response. Let me explain the potential side effects. By saying this, we ensure that the patient understands any possible effects the medication may have on their body. This antibiotic course must be fully completed. Here we emphasize the importance of finishing the entire course to prevent antibiotic resistance. We're moving to an IV antibiotic to treat the infection faster. This phrase informs the patient that a strong form of treatment is being administered directly into their bloodstream. I'll adjust your medication schedule based on your response. By saying this, we reassure the patient that their treatment plan will be tailored to how their body reacts. That's already 30 phrases you have mastered. Well done. Let's move on to our fourth topic, which is patient-centered care. We practice a patient-first approach to healthcare. This statement reassures the patient that their needs and comfort are our top priorities. Would you like me to explain your treatment options? With this phrase, we offer to provide clarity on the available medical choices. Let's discuss your care plan together. This invites the patient to be an active participant in their treatment decisions. Is there anything you're feeling anxious about? By asking this, we give the patient space to express any worries they may have about their condition or treatment. Would you prefer a private room if available? This offers the patient the option of increased privacy during their hospital stay. Do you have any dietary restrictions we should be aware of? With this question, we ensure that the patient's meals align with their medical needs, allergies, or cultural preferences. Let's go over your daily activity goals. Here we are helping the patient set realistic movement and exercise goals that support their recovery. I'll make sure you're as comfortable as possible. This phrase reassures the patient that we are attentive to their well-being and comfort throughout their stay. Would you like me to contact your family member? By offering this, we acknowledge the importance of keeping loved ones informed and involved in the patient's care. You have the right to ask questions at any time. This statement empowers the patient by reminding them that they are encouraged to seek clarity about their treatment. Let's move on to our next section, which is phrases for mental health and emotional support. I'm here to listen if you need to talk. With this phrase, we offer emotional support and let the patient know they are not alone in their concerns. Would you like a quiet space to relax for a moment? This phrase acknowledges that the patient may feel overwhelmed and offers them a calming environment. We have mental health resources available for you. By mentioning this, we remind the patient that professional support is accessible if needed. It's okay to feel overwhelmed. Let's take it one step at a time. Here, we normalize the patient's emotions and encourage a manageable approach to their concerns. I can connect you with a counselor if needed. This phrase offers the patient an additional level of psychological support if they wish to speak to a professional. Are you experiencing any stress-related symptoms? With this question, we help identify whether the patient's physical symptoms might be linked to emotional stress. How are you coping with your diagnosis? Here, we check in on the patient's emotional response to their medical condition and treatment. Would you like some breathing exercises to help with anxiety? This offers the patient a practical method to manage feelings of stress or panic. Let's check in on your emotional well-being. With this phrase, we emphasize that mental health is just as important as physical health. You're not alone. We're here to support you. This statement provides reassurance and reminds the patient that they have a team caring for them. We are now over halfway through our list, and our next topic is technology in nursing and digital health. We'll input your information into our digital health system. This phrase lets the patient know that their records will be stored securely in an electronic format. You can access your records through our patient portal. Here, we inform the patient that they can review their medical history and results online. Would you like a digital copy of your discharge instructions? This question offers the patient a more convenient way to keep track of their post-care guidelines. Let's scan your wristband to verify your medication. This explains that their identification will be checked electronically to prevent medication errors. We're using telemedicine for specialist consultations. With this statement, we introduce the patient to remote healthcare services for added convenience. I'll document your symptoms in real time for the doctor. This phrase reassures the patient that their symptoms are being recorded promptly for medical review. Our system will alert us if there are any medication conflicts. Here we explain that technology is being used to prevent harmful drug interactions. We have remote monitoring options available. This informs the patient that they may be able to track their health from home using medical technology. You can track your recovery progress using the app. With this phrase, we introduce the patient to digital tools that can help them manage their health. Your electronic health records will be updated immediately. This statement reassures the patient that their information is kept current and accurate. Our next topic is really important and relates to phrases for handling modern health crises. We are currently following pandemic safety protocols. With this phrase, we explain that special procedures are in place due to an ongoing health crisis. Let me explain the new infection control measures. Here, we inform the patient about updated hospital safety procedures. Please keep your mask on while we assess you. This phrase reminds the patient of protective measures to prevent the spread of infections. You'll be placed in an isolation room as a precaution. By saying this, we reassure the patient that isolation is a protective measure, not a punishment. This is a high-risk unit, so extra precautions are required. With this phrase, we help the patient understand why certain safety measures are necessary. We need to screen you for flu-like symptoms. This informs the patient that routine symptom checks are required during certain outbreaks. This area is for COVID-19 testing. Here, we provide clear instructions about designated testing locations. We're implementing a new antibiotic stewardship program. This phrase explains that antibiotics are being carefully managed to prevent resistance. This vaccine is recommended based on your health history. With this statement, we help the patient understand why they may need an immunization. Let's make sure you're up to date on your boosters. This phrase reminds the patient about the importance of staying protected against preventable diseases. You have already mastered 70 phrases. Well done. Let's move on to our next topic, which is dealing with difficult situations. I understand this is a frustrating situation. I'll do my best to help. With this phrase, we acknowledge the patient's frustration while reassuring them that we are working to resolve the issue. We're experiencing high patient volumes, but I assure you we'll take care of you. This statement provides reassurance while managing expectations about potential wait times. Let's go step by step to address your concerns. Here, we encourage the patient to work through an issue with us in a calm and structured way. I'm sorry for the wait. Let me check on the doctor's availability. By saying this, we apologize for delays and show that we are actively working to get the patient seen. I know this isn't easy. Let me explain what happens next. This phrase validates the patient's feelings while helping them understand the next steps. I hear your concerns, and I will escalate this if necessary. Here, we acknowledge the patient's worries and assure them that their issue will be addressed at a higher level if needed. We're doing everything possible to get you seen quickly. This reassures the patient that their care is a priority, even in a busy healthcare setting. Let's focus on solutions together. With this phrase, we encourage a collaborative approach to resolving the patient's concerns. I'll ensure your concerns are addressed before you leave. This statement reassures the patient that they won't be discharged without a proper resolution. I understand this is overwhelming. You're in good hands. By saying this, we provide comfort and assurance to a patient who may be feeling anxious. Our penultimate topic relates to phrases for patient discharge and home care. Your discharge process is almost complete. With this phrase, we inform the patient that they will soon be ready to leave the facility. Would you like a summary of today's procedures? Here, we offer the patient a quick overview of everything that has been done during their visit. Let's schedule a follow-up appointment. This statement ensures that the patient has a plan in place for continued care. Do you have someone to assist you at home? With this question, we check if the patient has a support system for their recovery. We recommend you take it easy for the next few days. This phrase advises the patient to rest and avoid strenuous activity after treatment. I'll review your home care instructions with you. Here, we take the time to explain the patient's recovery steps and self-care responsibilities. Let me know if you have any transportation concerns. With this phrase, we check if the patient needs assistance getting home safely. You'll need to check in with your primary care provider. This statement reminds the patient to follow up with their regular doctor after discharge. This wound will need daily care at home. Here we instruct the patient on how to manage their wound properly. Make sure to complete your full recovery plan. This phrase emphasizes the importance of following all post-discharge recommendations. And finally, we are on our last topic, which covers phrases relating to nursing team communication. I'll hand over your case to the night shift nurse. With this statement, we inform the patient that their care will be continued by another professional. Let me update the team on your progress. Here, we ensure that all healthcare providers involved are kept informed about the patient's condition. I'm documenting all updates in your file. This phrase reassures the patients that their medical records are being kept current. We'll be doing hourly rounds to check on you. By saying this, we let the patient know that they will receive regular monitoring. Our team works closely with specialists for the best care. This phrase highlights the collaborative approach of healthcare professionals in treating the patient. Let's collaborate to ensure the best outcome. Here we emphasize teamwork in making decisions about the patient's care. I'll confirm the latest treatment plan with the attending physician. This reassures the patient that their treatment is being reviewed by the doctor. We have a care team meeting later today. With this phrase, we inform the patient that their case will be discussed among the healthcare team. Let's reassess your pain management strategy. Here, we check if any adjustments are needed to improve the patient's comfort. Your nursing team is here 24/7 to support you. With our final phrase, we are reassuring the patient that they are never alone and that help is always available. Well done, you've just mastered 100 brand new English phrases for nurses, an incredible step towards stronger, more confident communication in healthcare. If you're a student member, don't forget to download your PDF guide. It's the perfect companion to this lesson. And if you're not a member yet, consider joining. The link is in the video description. But don't go anywhere. Up next, we've got another 100 essential nursing phrases to take your English even further. I'm delighted to bring you this English lesson where you'll learn 100 English phrases for nursing. In this lesson, we'll cover 100 useful phrases divided into topics such as patient